the monthly meeting of the Health and Community Committee, which will be a hybrid socially distanced meeting to be conducted remotely via WebEx and physically in the Council Chamber, Guildhall, on Thursday, the 12th of May 2022 at 4 p.m. Start members with the roll call. So Alderman Devaney.
Here, Karen.
Alderman Guy.
Here, Karen.
Alderman Kerrigan. Alderman Kerrigan. Councillor Boyle. Michaela.
And Shaw here, Karen.
Councillor Carr.
Here, Karen.
Councillor Duffy. Councillor Edwards.
Shaw, Karen.
Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Fleming. Councillor Harkin.
Here.
Councillor McGinley.
And Shaw, online, Karen.
And Councillor Sonoya Barr.
Yeah, Karen.
And Councillor Tierney.
Here, Karen, on the chamber.
Thanks, members.
Thank you, Karen, and welcome to members and the Officer Corps. If I could read out the broadcast statement. I would like to remind everyone present at this meeting in the Guildhall or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at the meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website, www.derrystrabane.com. Members, moving on to item 4, which is a declaration of members' interests. It can either be done now or as the meeting goes on. So it's declarations of members' interests. And members, on your behalf, could I welcome our deputation today? And we have Louise O'Hara, Regional Organiser of Unison, and Trevor Lucy, Chair of Unison Foyle Health Branch. And it's to discuss the findings from the Unison survey, reference health service workers. So if I could invite Louise and Trevor to address the committee, please. Thank you.
Thank you, and thank you for the invitation to present to this committee. It's quite apt that it so happens to fall on International Nurses Day. And it is important today for us to recognise the vital role that members of the nursing family play, and we owe them a great gratitude. To give you some context, Unison represents 1.3 million workers across the UK, and here in Northern Ireland we represent 45,000 workers, with over 30,000 of those in the health service. In my role as a regional organiser, I cover a large section of Unison's membership in the Northwest. Look, pressures on our health service and the workers who deliver the service are well rehearsed, whether that be on the TV, on the radio, or in our newspapers. But for the workers in the health service, these aren't just press stories. This is their reality every day. So in October last year, Unison conducted a survey of our members in health across England, Wales, and Northern Ireland. This survey was focused on their mental health and the toll that the pandemic has taken on it. 81% of the Northern Ireland respondents stated that the pressures of working in the health service during the pandemic has impacted upon their mental health. That's a higher level than the respondents from England and Wales. The more detailed responses from the Northern Ireland respondents state that they're suffering from anxiety, depression, stress, weight loss, fatigue, and feeling like they're a failure at work and at home. What does it say about us as a society when the people who are there to care for us are being so let down by the system that they're falling into ill health themselves? Over half of the respondents stated that they have to work over and above their contracted hours. The reasons why these members most commonly state is because of staff shortages, and needing the extra money to survive, or both? Workers in our health service have enough challenges. Inadequate pay and financial hardship should not be one of them. It's not surprising then that only 3% of respondents stated that they felt valued by their employer, and more than half say that they're considering leaving the profession. A failure to form an executive to tackle the cost of living crisis and the crisis in our health service will be disastrous. The average grocery shop is up somewhere between 20 and 30 quid. The national insurance increase has caused the average nurse to lose around £25 a month. The mileage rates for domiciliary care workers, some of the lowest paid in our health service, are not meeting the exorbitant prices of fuel. Pay is not keeping pace, and workers are facing real-term pay cuts. It is unacceptable that key workers across our public services are being pushed into poverty. The pandemic has shown how much society depends on key workers, and they and their families deserve better. These issues can't wait, and the people can't wait. We may be in the way out of the COVID-19 pandemic, but for many, another pandemic is already well underway. I appreciate this committee cannot control what happens at Stormont, but the majority of you here are from political parties, and it is incumbent on you to use your influence to make sure those parties form an executive to deal with these crises. The massive contribution Unison members have made and continue to make in providing essential public services must be recognised. Now is the time to deliver for them. While the committee may not have direct responsibility for the health service, you have a responsibility to make sure that all the work that this council does is looked at with a health and anti-poverty lens. What can you do to improve the general health of the people in Derry City and Strabane? What can you do to help mitigate the financial hardships being faced by families? What can you do to demand funding for the health service to protect your constituents? And what can you do to make sure an executive is formed? Health cannot be viewed in isolation. All the decisions that this council makes have an impact. I've seen from your agenda that later you will discuss the response to the adult social care reform consultation. In social care, as our older population increases, we need a system that can respond not only to their needs, but the needs of all requiring care and support through a stable, well-trained and well-paid workforce. You should commit to resist the introduction of charging for domiciliary care and instead recognising that social care needs sustained investment. The pandemic has highlighted the precarious nature of care provision within a system that has been largely outsourced and privatised. Unison wishes to see a strong commitment to reverse the growing trend of privatisation and bring those essential services back in-house where they belong. I'm going to hand over to my colleague Trevor Lucy, who is, as you know, is the joint chairperson of the Unison Foyle Health Branch. But before I finish, I want to urge you to use your influence to support the cause of Unison as we head into a tremendously difficult time for working people and their families.
Thank you, Louise. Trevor, please.
Thank you. Well, I work closely with the trust, our local trust, and obviously with the members. And I'm just going to give you sort of a few stories and things that we've had to deal with over the past 2 years and where we are now, because we want obviously the council to keep encouraging good practice and stuff so we can come out of this pandemic safely and improve our services. So throughout the pandemic, we have seen massive attendance at our emergency department. Unfortunately, we're still seeing that today. Where on almost any day you could have anywhere between 70 to over 100 people in Galvin waiting to be seen, and some of the waits unfortunately are very, very long. And that is not good for outcomes for people, so that is still ongoing. So we're looking to, I suppose, get the council to help us a little there and trying to ensure that services are actually well used across our entire community. They don't all unfortunately need to go to ED, but many people go there because they're not sure where else to go. We've experienced massive pressures in our ICU departments over the past 2 years, and thankfully that position has improved massively currently, to the point where we had to run with 50% extra beds and try to find staff from a very limited pool. PPE is another issue, and if you're out in the community now, you can see there's very few people actually wearing any PPE anywhere, so they're not wearing masks anymore because they're not required to. And if you work in healthcare, I'm afraid that is a bit of a concern because there's still quite a lot of COVID within the community. Thankfully not affecting people as much as it has done previously. Our mental health is also under extreme pressure. Our mental health services will probably be under pressure for a long time due to the effects of COVID on many individuals. Some of that has been caused by isolation. Some of it's been caused by not getting good access to services because of the restrictions and the staffing levels that we've had to experience. Also within our community services, our domiciliary care has been under a lot of pressure. A lot of people having to isolate because they're going from house to house, looking after a lot of vulnerable people there, and that affect care packages. And it remains a huge difficulty trying to get people out of hospital now if they require packages. And we are, because of the large numbers of appearing at ED, we need to free up a lot of beds in the hospital, and that is an ongoing daily challenge. Our nursing homes were also hit very, very hard with COVID, both within the private sector and our own sector, and that was a huge challenge at the start of this outbreak. That was greatly improved with the rollout of the vaccines across our community for both our staff and the residents there. We'd like, obviously, that message to be promoted because there'll be more boosters currently and in the future, no doubt. Within the health service, we're still having a lot of things to deal with. We have a lot of staff, well, not a lot of staff, a number of staff with long-term COVID. We've had many staff obviously affected with COVID, and some have got very long-term, which actually has meant we couldn't put some staff back to where they previously worked. And we also have a number of clinically vulnerable staff who had to be moved into other areas. And these all affect our services. A lot of these staff are specialists in certain areas. As I say, today it looks much improved. The hospital has very few active COVID patients, but in the past week or so, those numbers have started to increase again. It's not alarming at this stage. We don't want to go back to restrictions, obviously, but thanks through good practice and promoting good community events and people still trying to social distance to some degree will help with that. As the position improves, we're trying to obviously improve all the elective surgeries and stuff that have been waiting, and the waiting times in Northern Ireland have historically not been very good, and this will be a huge challenge going forward, trying to improve that, and that would be something we'd like to deliver. That will improve our local population's outcomes massively. And it's really just an ongoing battle still, but it is getting better. That's really all I have to say. If anybody's any questions for myself or Louise.
Thanking you, Trevor, and I appreciate that from both of yourselves. I'm going to open it up now to the committee and maybe take a number of committee members and then come back to yourselves if that's okay. Councillor Harkin, Sean.
Thank you, Chair, and thank you, Louise and Trevor, for taking time out of your busy schedules for coming here today. And this is a very important presentation, and People Before Profit proposed this because we think it's very important that workers get a platform in councils or Stormont to actually put the challenges that they're facing across to elected representatives, so that they hear them loud and clear, and so they can act on them. And hopefully that's why this is useful today. And we will continue to do this because I think the voice of people who are in the coalface of keeping our society running and functioning needs to be heard loudly and more often, so that there's no denying what's actually happening. And the survey on which this discussion is based was shocking. I think that the findings are, very, very worrying. It's worrying how devalued our health heroes feel. I'm not surprised by that, but it is very, very worrying, and it requires action. The mental health impact, both of the staffing crisis and the pandemic, and feeling devalued, is really becoming a perfect storm. So the fact that so many of our valued health service workers are considering leaving is again very, very worrying, and that requires action. I also thought the point that that workers were making about their fear that the standard of service was dropping as a result of budget cuts and everything else. I mean, workers at the coalface have a real insight because they are bending over backwards to help people because that's what they do every day of the week. And also, but they also have a real understanding of the challenges within the health service. So, we have, unfortunately, we don't have an executive right now. It's not clear if we're going to have an executive. Then that can be at least the place where we can take the demands that you are putting forward for real change. From our point of view and from this council's point of view, I think this council will do well. I think we will try to have this council do whatever we can to support your demands for a real cost of living pay increase, which haven't gone away and are probably only going to get louder in the coming year. To continue the demand that was written into the new decade, new approach, but hasn't been delivered on for safe staffing, which is absolutely crucial. For, as you said, Louise, for a reversal of privatization, and I think some people who are maybe not as aware of the health service don't fully understand or appreciate the scale of privatization that's already taken place and has unfortunately been ramped up as a result of the pandemic. And I think what you've said as well about bringing other areas of health provision back into the public service is going to be key to raising standards for workers, for increasing pay in terms and condition, but also improving outcomes for people who are dependent on the health service. And we have to, that means we need a vast reduction of the waiting lists that are really completely out of control at this point. So look, I'm going to put a proposal in that we'll discuss later. I presume after you guys have left, but it really is, I think, what the unions have been campaigning on. But look, thank you guys for coming here today, and hopefully it won't be the last time you get the opportunity to come here and put across your points. So thanks again.
Thanking you, Sean. And as this is, Louise and Trevor, to yourselves, there's a number of speakers, obviously, given the importance of this topic. So I'm going to take a few more, and also to acknowledge that Alderman Kerrigan, Keith, has joined the meeting a while back. Councillor Duffy.
Thank you, Chair, for allowing me in, and thank you to Louise and Trevor for the informative presentation today. I would like to declare an interest as a member of Unison Community Branch. I do think that some of the information that Louise, that you have presented there in terms of the survey is really stark in terms of the pressures that are on healthcare workers, with over 81% of respondents saying that there has been a significant impact on their mental health due to working over the pandemic. I think that is a stark reality for many people. I would have a number of friends and family who work in the health service, from nursing to admin to social work, who have been under similar pressures, and you can see it in their daily lives and the pressures that they're under. So I take completely on board that, and they have been going over and above their contracted hours due to the staff shortages and the inadequate pay that they need then to continue to survive. I think it's really disappointing to hear that people do feel that they are not valued. As somebody who has recently had need to use the emergency department, I have to say that the staff working in the emergency department under severe pressure were working, they were so caring and so compassionate in the work that they were doing. I just need to put on record my thanks, my personal thanks to the workers in the ED in Galvin. In terms of the bigger picture, absolutely, we need the executive up and running. There is many issues that need to be addressed. There's many pressures right across the sector that need to be looked at. We need to release funding. We need to get £1 billion invested into health if we're going to make any sort of impact at all. And you talk about the cost of living. all those issues are paramount, that we get those on the table and get them addressed, and we won't be able to do anything without an executive. So Sinn Féin is there, Sinn Féin has turned up, and Sinn Féin is willing to get into an executive on Friday at the earliest opportunity. So we are there, and Sinn Féin has continued to meet with the unions. We've continued to listen to the unions, and we will continue to do that. But I would like to thank you for your presentation today and taking time out of your day to come and have this conversation with us. And I do look forward to you coming back and perhaps it being in person and in the chamber. So thank you to Louise and Trevor. Thanks.
Thank you, Sandra. Councillor Tierney, Brian.
Thank you, Chair, for bringing me in, and thanks to Louise and Trevor for coming here today and I suppose giving us this deputation. First and foremost, I want to take this opportunity to wish all of our nurses across this district and Fuller Field a very happy World Nurses Day. As someone who's married to a nurse, and that's a declaration of interest, I suppose I have to get that out of the way first of all. I think some of the statistics that's coming back from the survey are frightening, but I think, you know, if we're going to be really, really honest, we know a lot of them. For anyone who speaks to anyone who is a healthcare worker, we hear regularly the pressures that they're under. I unfortunately had reason to attend A&E last week, and you know, everybody, no matter what job you do, everyone thinks that their own job is stressful, and many of them are. There's no doubt about that. But I could never imagine working in A&E. I don't think I would have the ability or the mental capacity to get through it. There was not a seat in it whenever I was in last week, and it was hugely worrying and concerning, the amount of people who needed care and needed support, and was all at the shoulders of those working there. And I definitely take my hat off to them. I think it's also very, very concerning that a number of staff have commented on how working through the pandemic has had an impact on their own mental health. And I think, you know, Louise touched on, you know, what's our responsibility as a council. Everyone knows that the responsibility for health lies with the Stormont executive, but you know, we have a responsibility, I think, as well as a council, to make sure that not only are the executive listening to Unison and to the healthcare workers, but making sure that we're amplifying that voice as well whenever we can. It's no surprise to me that a number of staff have commented within the survey that they are considering leaving working for the trust, and that they feel undervalued. I know of friends who have left the Western Trust in particular, and went on to do the same job in the same ward, banking, because there's more money in it and they can pick and choose when they work. And if that is an option for the trust, and I have never been able to get my head around how the trust can afford to pay a banking staff less than that they're paying their own staff. It just does not make financial sense in my view. But it's no surprise to me that a number of staff have commented in the survey around doing that. But we have to make sure that we are providing the right opportunities where staff's voices are being heard. It is no longer, in my view, okay for us as a community, and particularly us as elected representatives, to stand at our front door on a Thursday night and clap the health service and the healthcare workers, and then do nothing about it whenever we have the opportunity. And I know healthcare workers who stood on their front doorsteps throughout the pandemic on a Thursday night when people were applauding them and broke their hearts crying because of the stress and the strain that they were under going into their work to try and keep us and our relatives and our community safe. And I think we, as elected representatives, have a responsibility to make sure that we're supporting them and make sure that as and when we can, we are doing all we can to amplify their voice. But Louise touched on it. The responsibility lies with the executive, and it lies in Stormont, and that's the reality now. I don't know whether there's going to be a sitting of the Assembly tomorrow. Up until about 2 o'clock there was no movement on it at all. And unless positions have changed within the last few years, it doesn't look like it's going to be likely. But anyone, particularly on this meeting, who over this last number of weeks and months has been round doors in Derry knows exactly what the issues that the people in this constituency, and I would assume that it's the same in West Tyrone, are facing. Not once, Chairman, not once did I hear anyone talk about the Northern Ireland Protocol whenever I was going round doors in Derry. And that's the stumbling block for the executive. It's not an issue for people in this council area, in my view. Therefore, it should not be an issue that we are hiding behind whenever we're having this discussion. The SDLP are obviously, unfortunately, due to the outcome of the election, will not be in an executive, but we will be in Stormont, and we will be there to make sure that we're doing all we can to support healthcare workers and doing all we can to make sure that extra funding is directed towards the health service. But the reality is, the executive needs to be formed. It needs to be set up. There are a number of issues that have come across from whenever we were speaking to people on their own doors. And unfortunately, the one issue that is holding the formation of the executive up is not an issue, in my view, across Derry. And hearing representatives, senior representatives from one political party on the media saying that they are prepared to go to election after election after election until the protocol is sorted out, in my view, is shameful, because it is not an issue for a majority of the people across this council area, in my opinion. And I think we all collectively, as a council, have a responsibility to ensure that we are making sure that the voices of the people that we represent are being heard, not only in this chamber, but also being made sure that we are feeding that information up through our own political parties and making sure that we can do all we can to support and get the Stormont Executive back up and running. Louise and Trevor, thank you very, very much for your presentation, and anything that we can do to support the work that yourselves through Unison are involved in, we're more than happy to do so. I'm hopeful that we will see you back, hopefully in the chamber in the not too distant future, where we can actually talk about how we can support yourselves by supporting the workers that you represent. But for now, thank you very much for your presentation. Thank you, Chairman.
Thanking you, Brian. Louise and Derek, I'm going to take one more speaker in this section, but as I say, there's a fair number of speakers given the importance of this topic. So after the speaker will come back to yourselves and then go back to the elected members. For now, Alderman Devaney, Morris, and just to acknowledge the declaration of interest from Councillor Harkin, a member of the Unison community, a Unison community member. Sorry. Morris.
Thank you, Chair, for allowing me in, and I welcome Louise and Trevor here with their presentation today. And, you know, especially on World Nurses Day, it was very poignant that this presentation is given us today. And, you know, on behalf of the DEP, I want to put on record our thanks to all the health service staff from one level to the other who have worked tirelessly over this last 2 years. And yes, I do take on board the issue of the results of the 81% workers affected with mental health, and the others 50% working over and above. And some of those are doing it in kind, but there's some of those trying to make ends meet at the end of the day. And look, our party is in the call for a fair salary across the health workers and, you know, many other workers across all other sectors because of the rise and increase, severe rises and critical rises in the cost of living and energy crisis that we're in. And I listen to Trevor, we always encourage good practice. And look, one of our last meetings, Trevor, their issue was raised and around accident emergency. And I believe, and I did state at that meeting, that look, we need to sort the GPs out to sort the accident emergency out, because if the GPs aren't working, it causes a problem within accident emergency. So we have called on some speakers to come. We have asked for the Royal College of General Practitioners, Dr. Laura Stormont, to come to a meeting, and Neil Gookie and the Western Health Trust to come to discuss that, because I do believe that the GP issue has to be sorted before we can sort out the issue with accident emergency, because one is a knock-on effect by the other. I do take on board as well the issue and around staffing. very, very difficult atmosphere at the moment for staff in there. And yes, as I've stated before, agency staff are employed in there, and it's very, very difficult for a staff nurse or whatever the case may be to be in there earning a certain salary. And then you have a colleague or a friend working beside you who is in through agency staff and maybe earning maybe twice, maybe three times the salary. It is soul searching, so it is. But look, the previous speaker said we are here as a council. Yes, we need the executive up and running, and it's my wish that that should happen to get things sorted. But I also welcome today, we say that nothing can be done. I've just noticed here that earlier today, the Health Minister, Robin Swan, has announced 2.1 million of investment to boost education and training, to boost the health service. So we have to put on record our welcome for that money being handed out there. And look, Louise and Trevor, our party will be the voice that, within council as well, along with colleagues, to amplify the concerns across the health service and in this difficult time that we're going through at the moment. But thank you very much for the presentation.
Thanking you, Morris. I have a number of further speakers, but for now I'm going to go back to Louise and Trevor, if you have anything in relation to what you've heard so far.
No, it's welcome to hear so much from the committee for the presentation and the calls that we've made. And I don't, unless I've missed it, I don't believe there really is a question anywhere there for me to respond to, but I do welcome those supportive comments. And yeah, I'm happy, Trevor, unless you've got something to add, move on to the other speakers.
Okay, Louise, Trevor.
No, it's glad to actually hear everybody's comments and how well informed you are. Staffing is a huge issue. It's actually having enough nurses and doctors to actually fill all the gaps is the problem as well. So it's going to the education side of the house. And we would like more people to be trained because it's a 10, 20-year plan to actually resolve that issue.
Okay, Trevor, thanking you. Folks have a number of speakers, and just to make people aware of Councillor Ferguson, Councillor Boyle, Alderman Hussey, Councillor O'Neill, Alderman Guy, and Councillor Farrell. So if I could start, please, with Councillor Ferguson. Rachel, please.
Thank you, Chair, and thank you to Louise and Trevor for your presentation. And I promise I won't keep you long. You've got a long list of councillors and aldermen behind me. I wanted to thank all the NHS staff and all the Unison members too, and say happy International Nurses Day. Obviously, your statistics are scary, and we've seen the outcome of the survey, and we're not surprised. It's a bit similar to the one that we've seen with the retail staff and the pandemic and people being treated really badly and not feeling safe and secure within their job. I know the Alderman before me had mentioned that the Minister has announced the Education Fund today, and that is welcome in the respect of workforce planning, because I know it's a huge big one for yourselves in trying to actually get nurses in place alongside the issues of not being paid enough and moving over to banking staff. Trevor, you really kind of I think you had come up with some amazing ideas there on how we as a council, because everybody can rehearse the issue with Stormont and the executive and my party alliance are there to work. But I wanted to see practically what we could do as council. So you were saying that if we could reinforce messages like pathways away from the emergency department, if we could reinforce the COVID PPE, wearing mask, hygiene stuff, try and do that within our own social media and as councillors. And Louise, and I wanted to see if there was anything more you thought, like I know you touched on our policies and poverty and deprivation and health and trying, but just anything very quickly in the top of your heads that you thought that we could be doing that better, that council could do to help and try and take the pressure off yourselves, because at the end of the day it will come down to Stormont and the executive, and I can only say the only saving grace is we do have a caretaker minister in the moment to put out certain funding. But again, I wanted to thank you for coming today, and it is good to have you here and to highlight the issues, because we don't hear enough from the workforce, we don't hear enough from the lived experiences, so it is great to have you here in the chamber. Thank you.
Thank you, Rachel. Councillor Boyle, Michaela.
Thank you, Chair, and want to give my thanks also to Louise and Trevor for coming here today, and indeed to echo my colleagues' sentiments and thanks to the nurses on World Nurse Day. Chair, I don't have a question as such, but obviously just comments, and I'm just conscious of time too, and keeping everyone here. But you know, we started off about the survey, and Louise, you did go in depth to it. In fact, you know, when I was listening to you, I could have been listening to you in the 6 o'clock news tonight, because you know, I think that's you give a damn good presentation and a glaring observation of exactly what's going on within our healthcare system, and indeed how it's impacting on our frontline workers. So kudos to you for doing that. It was well delivered. I suppose just when we talk about what we can do in council, we have submitted motions, questions, wrote to the minister. I think we've done everything we can and could, and we'll continue to do that. I submitted a motion to council just Monday past that was unanimously supported to adopt, calling on the health minister to adopt policy initiated by the finance minister, Conor Murphy, to make paying workers the living wage a requirement for any private company receiving a Department of Health contract, and that was particularly around domiciliary care workers, and to also make the payment of a fuel cost allowance in line with the public sector rates a further prerequisite of any tender. And those are the type of things that we, you know, can do within council. Whether they get heard or not is another matter, but that's the type of work that we will continue to do. Unfortunately, we talked about privatisation as well. We're being forced down a route of privatisation, and I'll just give one example of a family member of my own, my granddaughter. My daughter, who is since COVID she's 14 years of age, and we've had to pay for her podiatry and physiotherapy privately, you know, rather than wait for 4 years for her to be seen because of a recent diagnosis that she's had. So those are the type of things people are being forced into debt, having to borrow financially from credit unions and banks and family members, just so that their children can be seen quickly and efficiently, and once they get a diagnosis. As I said, the pandemic has only further highlighted the austerity within our healthcare system, and we know the pressures within our own trust area. I think there is a lot to do in terms of rebuilding the health service. Urgent action is required to protect our NHS and the health service that we do have here. It needs genuine reform. It needs genuinely resourced and properly funded to have a healthcare system fit for purpose, and that means reform from the top down, in my opinion. There's a lot of systems within our healthcare system that are working, and that's thanks to our frontline workers and our healthcare workers and staff, but there's a lot more can be done in terms of contracts being given to the private sector with no diligence and things like that, and contracts being handed to the bigger corporations. So there's a lot of work to be done. Obviously, you know, you can't do this without resource and funding, but that's only part and parcel of the issues that we're facing, and there's a bigger picture that we need to be looking at, and that is reforming our healthcare system also. So thank you to both of you for coming today, and as someone said, an poignant day, World Nurse Day, and keep up the good work.
Thank you, Michaela. Alderman Hussey, Derek.
Thank you, Chair. I'm not a member of committee, and I do appreciate the opportunity. I'm just mindful on the day that's in it, a recent survey that I've seen rated nursing as the third most important occupation in our community. I'm sorry, but I disagree with that, and I think it's a much higher rated occupation within our community. And I say that as someone who has had and does have family working throughout the NHS. My late mother was a hospital cleaner. My late father was a male nurse. I have immediate family members in admin, nursing, and indeed right up to consultant level. So the empathy is there with you, and I thank you both for your presentations. I'm sure you will agree that the current situation we find ourselves in, it didn't materialize yesterday. It's been coming down the tracks for years. I sat in the Assembly chamber when Michael McGimsey more or less begged for additional resources and funding to the health service and was sneered at by others in the chamber. Others have had the opportunity since. I remember, I'm talking about ministers like Barbara de Bruyn, and indeed our current First Minister in waiting is a previous health minister. They've had the opportunity. So in saying that, I have to welcome today's announcement from the interim or holding health minister of the 2.1 million for education and training, because staffing is a major issue, and we've seen that particularly over this past while. Another issue that sits in there is the issue of multi-year budgeting. And I wonder, could you comment on those two issues? Will the 2.1 million have an impact on the issues that you face? And would it be a major desire that we have multi-year budgeting within the health service to enable proper forward planning? But I thank you for your presentation. Support your desire that the resources are there to properly remunerate staff, and indeed to fund the resources that are needed within the service. Thank you very much.
And you, Derek, and Louise and Trevor will come back to yourselves. There's 3 more speakers and from the floor, and then I'll come back to yourselves. Councillor O'Neill, Maeve.
Thank you, Chair, and thanks for letting me in, given I'm not a member of this committee. And just a declaration of interest as well as an employee with the Western Health and Social Care Trust and a union rep for the Charter Society of Physio. And thank you, Louise and Trevor, for your presentation. It's great to have you presenting here in Council today. And happy Nurses Day as well to all our colleagues who just inspire me every day with their dedication and care and skills. I think, working in the health and social care service every year, I think we're saying, God, it's just never been as bad as this. But like really right now, I've never seen the number of staff leaving that there is now. We're literally hemorrhaging staff, and there's a whole variety of reasons that's happening, like stress, like the staffing levels, flexible working, and of course pay. And I think it is really disgraceful that right now we can't form a government because parties can't respect the democratic mandate when we have a health and social care crisis like the one we have in our hands. And for me, the first thing that I thought of when this reality sunk in that we won't have a government was, what are we actually going to do this winter? There was like a sinking feeling in my gut, like, what will the health and social care service do? How are we going to get through this winter if a government doesn't form and actually put the funding in that's necessary? And when I look back at the last strike back in 2019 before the pandemic began for pay parity and safe staffing, like that people powered action, which the unions led, and it was a superb campaign backed by the majority of people in the local community. That strike of health and social care workers forced Stormont back in at a time when they were out for several years. And I think that is what we need right now. We need that people-powered movement, that people-powered action from unions and from the local community. And we can't wait for Stormont to get back in. We need to take action now, because we really have a fight on our hands for the future of our health and social care service, which we are all immensely proud to work for, and to give service to people. And we want it to be the best that it can be, but I mean, there's been decades of underfunding, decades of privatisation, but now is the time that, you know, COVID presents a real turning point where we have really seen the value of our health and social care service and the workers, which are the most important thing within it. They make it operate, and you know, that is what was the issue in the doors during the election, but it is the issue of our time right now. And I think, you know, this is now or never. This is a turning point, and you know, I think that people powered action to fight for the future of our health and social care service is essential. Thanks.
Thank you, Maeve. Alderman Guy, Darren.
Thank you, Chair, for letting me in. And I'd like to thank Trevor and Louise for the presentation today, especially Louise. Excellent presentation. Especially on International Nurses Day. On behalf of the Ulster Unions, I'd like to thank all nursing and medical staff for the great job that they actually do. Look, I'll get over with Robin Swan, the Health Minister's announcement today about the 2.1 million for education and training investment to boost healthcare workforce. Obviously, there's a few factors on there, nursing, midwifery, etc. Places for 22-23. Also, the 1.5% consolidated payment amount, which was announced over 3 months ago. As far as I know, it's still not been paid. As far as I know, it's due to issues with the BSO, and I don't know how that's been sorted out yet, or whether it's even close to be sorted. Obviously, problems with A&E. It's in a sorry state. Personally, my own personal view on that there is the GPs need to step up to the mark. Yes, I know that they are working. The GP service that I use has been second to none the whole way through the pandemic, but I have heard issues with other practices, and it's nearly as if sometimes when you criticise the GPs, they're not willing to take their fair share of the blame, and they'd rather heap it on to the hospitals and the A&E themselves. Just following on about what my colleague said, Alderman Hussey, and I'd just like to ask Trevor, on behalf of the unions, you know, how does the unions actually feel on the issue of banking? Now, I know they're obviously getting paid a lot more money than normal NHS nurses and trust nurses. And whilst there is nurses leaving the profession for different reasons, burnout and so on, through the times that they've had to put up with COVID and stuff, but also a lot of nurses are moving because they're underpaid and it's chance to earn more money for the same job, banking. How do the unions feel that this should actually be dealt with? Obviously, we'd all like to see the nurses' wages raised to that level of banking, but is it time for there to be a cap put on banking, or even numbers-wise, so that they can prevent nurses leaving, and we then spend time to raise the nurses' wages to an adequate living wage level? Thanks very much anyway for the presentation. Thank you. Thank you, Chair.
Thanking you, Darren. I have one more speaker, Louise and Trevor, and then I'll come back to yourselves. Councillor Farrell, Rory.
Yeah, thanks, Chair, and thanks, Louise and Trevor. And it's very timely that you're here on International Nurses Day. And for me, the survey crystallises the strength and depth of feeling across health staff and the pressures that they face on a daily and nightly basis. You know, the reality is that, you know, NHS staff should be cherished and celebrated. But that's not the case. They're burnt out, they're exhausted, they're overworked, underpaid and undervalued. We've got spiraling waiting lists, we've got underinvestment across all services, and we've got a complete failure to adequately staff the NHS, and that's an absolute scandal. from an SLP perspective, we want to see an extra £1 billion invested in the health service. We want to see a 6% pay increase for nurses. And this can't happen without an executive. And we can't have an executive until the DUP put people before party and people before the protocol. So it's our view that it's time for the DUP to accept the election result. It's time for the DUP to nominate a Deputy First Minister. And it's time for the DUP to go back to work, because none of the problems that society faces, whether it's in health, education, cost of living, none of them are going to be fixed until the DUP grow up. Thank you.
Thank you, Rory. Louise and Trevor, I know there was a number of queries in there, but if there's any other comments as well as maybe addressing the queries, thank you.
So Rachel, I think, had raised the question just about, what other things might this committee or the council be able to do. I know it will not come as news to most of you that deprivation and its link to poor health is well known, and as the cost of living crisis really takes hold and drives more people and more families into deprivation, what we're going to see is an increase in what the healthcare and the health needs that they have. So anything that this council can do, as everything else soars, to reduce the financial burden on families and homes in the area, can only kind of prove to help them keep themselves well and healthy, and not have a future need on our health service. And then the other comments, hold on. I think any investment at all in our health service is welcome. So the 2.1 million will go some way to addressing some of the issues, but there is need for more. It is very difficult for trusts to look at how they reform the services they do with non-recurrent funding. It results in there being a number of projects which may come to an end at any time, and people who are in those posts delivering those projects being, let go of. So recurrent funding is necessary, so that and a multi-year budget to be able to deliver that, so that these projects and the transformation work that actually needs to take place has grounding in knowing that the funding for it isn't going to dry up in a year's time or 2 years' time. On the other comment around the 1% and 1.5%, to answer Darren's query about that, no, that hasn't been paid yet. And the latest indication that we're getting through from both the Department of Health and from BSO is that it's going to be September before that comes in, and that is entirely unacceptable. That announcement was made in January. People are expecting that money, and for some reason it's not being processed, and it isn't still being processed. And it's going to be September before people get that. Now, obviously, from the union's point of view, we're challenging that length of a delay. This is something that needs to be done urgently if we're going to, try to mitigate the exodus from the health service. But if there is any influence that this committee can bring to bear on those processes to make a call for that to be speeded up, and for people who are entitled to and owed that money get paid it before September.
Can you, Trevor?
Yeah, just to respond to Darren Guy there. Yes, Darren, it's a huge problem. The high cost agency workers, which many of which are nurses, but not all nurses, is a huge problem, but it is driven by supply and demand. We are extremely short of nurses everywhere, in every trust. We're short of nurses. We probably could do with several thousand more in Northern Ireland alone. It was a desperate need during COVID and the pandemic, unfortunately, to allow us to deliver safe services. So personal position, Unison's position would be prefer not to use them at all. If we must use them, I would like to see a cap in the rates, because it seems these people can set whatever rate they like, and the trust then is obliged to pay it. And it's really depleting resources that are already very, very limited. We would prefer people would take contracts with the trust themselves, because we've better paying conditions, we've got better pension provision, and a lot of things. So, people are taking, in my opinion, a very short-term gain financially, but they're not looking to the future whenever they come to retirement and maybe haven't put much money into a pension fund, and then that'll just be another big issue at that point in time.
Thanking you, Trevor. And on behalf of committee, can I thank both yourself and Louise for today's presentation and articulation of the very pressing issues faced by your dedicated staff. And certainly, I think you've heard from around the table today that people need to get back to work and need to ensure that the resources needed are put in the direction that they need to be put in. So as I say, thank you for your presentation today, and the meeting will go on YouTube, but if we could just say to yourselves, thanks, and the technical people will sort the rest of it out, if that's okay.
Thank you.
Thank you. Members, in terms of, there was to be a second presentation today by Saoirse Fannin, a Unison Community and Voluntary Sector. Saoirse has tendered her apologies in terms of today not being able to make it today, but looks forward to making it another day in the future. Okay, members, with regards to Councillor Harkin, Sean, with regards to the proposed motion, I would ask that is put to full council, given the importance of it and the implications of it, that it would go to full council. And obviously there's time for that to happen for this month. So I would ask that goes to full council. Okay, members. Moving on to Chairperson's business, and if I could ask Councillor Harkin, Sean, in terms of the important issue you have to raise.
Thank you, Chair, for letting us on this. And yeah, I'm sure that colleagues seen that Shireen Abu Akleh was killed in the city of Jenin on Wednesday by the Israeli army. And this has been condemned across the world. And I think it again puts a spotlight on apartheid Israel's permanent war on the Palestinians, which maybe doesn't get the attention that some other conflicts get. But this is, I think, goes to the heart of what the problem is there. I mean, Shireen herself has been working for Al Jazeera for 25 years. This was an IDF raid in the occupied part, the illegally occupied part of Palestine, the West Bank, the city of Jenin, and unfortunately she was killed. There will be a full investigation into this, but there is accusations right now that she was targeted because she is someone who is relentlessly, told the truth about what Israel's occupation of Palestine looks like, and that has made her an enemy of the Israeli state. And it's very unfortunate that she is dead, because we will lose a voice now that has been a global voice that has been able to communicate exactly what happens, what the lived experience of Palestinians is on a day-to-day basis. And indeed, that's what she was doing the day that she was killed. So I think that given our council's corporate position in support of the Palestinian people, it was important that we took the opportunity to mark the significance of this. Obviously, as a council, our condolences should go to her family and friends and to all that are dealing with the loss. She's also a loss to the world of journalism. And if I can quickly just read out some of the statements from journalists, so that from the Federation of Journalists General Secretary Anthony Bellinger, he says, he says that testimony from journalists who were with her suggests that this was deliberate and systematic targeting. Journalists clearly identified were not alongside demonstrators. They were not a threat. They've been targeted to prevent them bearing witness and telling the truth about Israeli action in Jenin. The Derry and Northwest branch of the National Union of Journalists write, if we demand justice for Ukrainian journalists targeted by Russia, we must also demand an end to and justice for Palestinian journalists targeted and killed by Israel. I just think it's, we need to make sure that conflicts that are not backed, there's no calls for NATO to go in here, obviously, and do something about this. There's no calls from the British government. This will be largely ignored by a lot of governments. I don't think that's acceptable. I don't think our council should go along with that. I think we should speak up when there's crimes like this one, the murder of a journalist doing her job. And I want to encourage people to, the National Union of Journalists are having a vigil at the Guildhall at noon on Saturday, and I would encourage people to attend that want to stand in solidarity with Shireen and stand in solidarity with her family, friends, and all those that are, suffering her loss right now. Thank you, Chair.
Thank you, Sean. Councillor Duffy, Sandra.
Thanks, Paul, and thanks to Councillor Harkin for bringing up this really important issue. I would like to join and add Sinn Féin's voice in terms of condolences and solidarity to the family and friends and journalists throughout the world who are suffering the loss of their colleague at this time. Watching some of the news outlets yesterday as they reported this was absolutely heartbreaking, but it was also stark that some of them didn't. I think that needs to be commented on. The killing of Shireen Abu Akleh is absolutely outrageous. She was shot in the face while doing her job, covering an Israeli army attack on a Palestinian refugee camp while clearly wearing the blue flak jacket of press. The international community must absolutely hold Israel accountable for this barbaric action. It can't be swept under the carpet. It needs to be dealt with and it needs to be exposed. And I know I've seen nearly absolution being given to Israel today in some parts for what they have done. And I think we as a council should be adding our voice to the condemnation of it. So thank you, Chair.
Thank you, Councillor Duffy. Folks, moving on. Sorry, my apologies. Councillor Farrell, Rory.
Yeah, thanks, Chair. And I would just like to speak on behalf of the SDLP to echo the sentiments of the previous speakers and to utterly condemn the cold-blooded murder of Shireen. As others have stated, she was wearing a press vest and she was targeted by Israeli snipers and she was shot in the head. That's unjustifiable, unacceptable. That can't be allowed. And for the Israeli state to just behave as normal, nothing to see here, it's disgusting, actually. So totally condemn the killing. So thank you.
Thank you, Rory. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in, and I have to agree. Look, we would send our condolences to the extended family. Look, if it is factual that this lady journalist Shireen had been targeted by anyone, and it just brings to mind, Mr. Chairman, the issue and around one of our local journalists, the murder of Lyra McKee. The time she was murdered, I would say it was cold-blooded as well. But look, no problems, Chair, and sending our condolences to the wider family and around this issue.
Thank you, Chair. Thank you, Morris. Councillor Ferguson.
Thank you, Chair. And I just would like to add my party's comments to previous speakers and offering my condolences to Shireen and her family and her colleagues. I think it's absolutely atrocious and disgusting what has happened. I think it has to be spoken out against and condemned fully. I think the fact that we have seen so much outrage when it comes to other conflicts and journalists being killed and very little apart from on social media when it comes to Shireen and the fact that she was wearing press blue. But Chair, no, I just wanted to make sure that we have our solidarity with Shireen's family and friends and journalist colleagues and send our condolences and condemn the awful murder of her. Thank you.
Thank you, Rachel. Councillor Tierney, Brian.
Chair, thank you. And Councillor Farrell spoke on behalf of our party, but I think it's important and it's something that I cannot allow to run on without bringing it up. I want to disassociate myself and the SDLP with the comments of Alderman Devaney, who said if she was targeted by anyone who's watched the news over this last couple of days can see very clearly that was the motive behind it. And in our view, and particularly in my own view, as someone who's watched it and who has understood and seen very clearly what was going on, in my view, there's no if about it. She was targeted, and she was targeted, in my view, because she was shining a light on the very, very dark corners. And people knew that. She was very clearly identified as a member of the press, and for that reason, she was targeted. So for me, I do not want to be associated with the word if she was targeted, because it's very clear to me that she was. Thank you.
Thanking you, Brian. Thanking you, members. Members, moving on to item 7, the minutes of the reconvened Health and Community meeting held Thursday, the 21st of April. For accuracy, pages 1 to 24. Proposer and seconder, please.
So proposed, Alderman Devaney.
Thanking you, members. Seconded by Councillor Tierney. Thank you, Brian. Members, moving on to matters arising, and if I could bring in the Director, Karen McFarland, who has a couple of matters arising, which might give an update on regards to some of these issues, and then I'll come back to members. Thank you.
Members, just 2 items very quickly in response to queries at previous meetings around, firstly, hospital car parking, so HC 9322. So that the response has been received from the Trust, which advises that the hospital car parking bill, which abolishes car parking charges at hospital sites, has passed all stages and is waiting on royal assent, which anticipated would be due in May 2022. As it's in the final stages of approval, the bill was amended to provide for a 2-year implementation timeline, and assuming that royal assent is given, then the parking charges would be abolished from May 24. So there is now a regional working group being led by the Department of Health to agree a consistent approach as to how traffic would be managed on very busy hospital sites, whilst assuring that the most appropriate and best access can be given to site users, patients, visitors and staff alike. So members, that is the update, just for your information.
Is there another one?
Yeah, Chair, the second one is just HC 10722. It was the People in Place review table for your information. And it's just to advise that in recent days, we've received some further information from the department who are seeking to move forward that review. They are looking to set up co-design partnerships on a district council basis area, which will incorporate neighbourhood renewal, the wider community voluntary sector, but also other organisations. We will bring a paper to the next Health and Community Committee on those proposals, and also there will go a paper to the Strategic Inclusive Growth Partnership, because membership is sought from the Strategic Inclusive Growth Partnership. And what we're suggesting to the department is that when those 2 processes conclude, the nomination process that they are managing completes, we would be willing to move forward as partners in that co-design approach. So there will be no changes currently to neighbourhood renewal until that process completes.
Thanking you, Karen. Members, Alderman Hussey, HC 95.
Thank you for the opportunity again, Chair, and for your forbearance. The 95 was with regard to, at that time, proposed strike. One of the strike was that pitches, higher for pitches for matches, etc., was impacted in that. Although time of year probably didn't impact that much because a lot of the leagues would have been finished, etc., football pitches anyway. It's a question arising out of that as to when does pitch hire application open for both matches and training, and is it the same date across the council area for all locations? Secondly, is the process the same for all such pitch hire applications? And thirdly, is the criteria for allocation the same at all locations? Thank you, Chair.
Thank you, Derek. Barry, please.
Thanks, Chair. In relation to your question, Alderman Hussey, it opens, I haven't the exact date, but it opens in the summer every year, around June, July time. And that is for our pitches allocations to leagues, individual clubs, and also for hire of our 3G facilities as well for fixture programmes in advance of the year. There is a consistent criteria, be it for a league or for a club or for a 3G facility, and it is consistent. Well, when I say consistent, it's different if a league are looking at an allocation as opposed to a club applying for a pitch, based on, a lot of it will be based on the criteria of the league they're playing in. So the criteria might be slightly different around the booking procedure depending on the league that you're applying for. Thanks, Chair.
Chair, with your just a quick comeback on that. Could I have a copy of the criteria for pitch hire across the council area? Could that be sent out to me if it's possible, Barry? Thanks, Chair.
Okay, that will be available. Derek, aye. Yes.
Thank you.
In this issue. Councillor Tierney on this issue, please, Brian.
Thank you, Chair, for allowing me on, and thanks to Alderman Hussey for bringing it up. Can I also get the criteria sent out to me as well? I'm aware of one particular club who have a number and a range of age groups that are playing under their banner, if you like, and I know that they find it difficult to try and get pitches, and I know, for example, that on numerous occasions, and I think actually two of their teams have now almost used a pitch outside of this council area as a home pitch because they can't get the facility on a Friday evening around National League stuff. So I think it would be good to find out the criteria, and then also maybe to find out what we can do to facilitate clubs who are currently playing outside of this council area. And particularly, Chair, it's difficult for underage teams because if they were playing in a local venue, more of their family and that will be able to go. When you're playing outside the council area, it's a bit more inconvenient. So if we could find out what we can do to try and help and support clubs where they're looking for a permanent, albeit council-owned facility, but one that they can regularly depend on. They be playing football at different age groups throughout their club. Thanks.
Thank you, Brian. Councillor Duffy, Sandra.
Alderman Hussey has opened a can of worms. No, just on that, Barry, and not to give you additional work, but just in relation to it, because a lot of issues have been raised in relation to pitches, the availability of pitches, the deficit of pitches throughout the council area. And I know that there has been a lot of work done in the past in relation to the mapping out of what we have, what standard it's at, and what is available and what's not available and what we need. Could we maybe get that in a report again in terms of an updated status of the pitches across the council area? Because I know, we've all been outdoors over the last wee while, and it has been raised by a considerable amount of people throughout football, GA, all the different sports in terms of their access to council facilities in relation to it. Could we get that? Or is that a while out of work?
No, through yourself, Chair. No, that's something that we can get readily. Members will be aware of the 2 reports we brought in the last 18 months. A lot of it around refurbishment of grounds, access, dugouts, you know, that type of stuff, stands, also our change pavilion. So there's been a couple of capital developments as well, and some planned in the future. So that'll show you where the deficit is. So that's something we can pull together. Members will be aware there'll be also asks and papers brought forward to Capital Working Group. And I think, you know, in terms of our criteria, just to answer Councillor Tierney, the criteria based on what level you're playing at, be it a National League or playing in the League of Ireland, it's all very, very different. So in the absence of another, I would hate to quantify a number of pitches, it would be virtually impossible to provide a club with a council facility that all their teams can play at. The short answer is, what can we do to help them? Build more pitches is the short answer to it. Build more 3G, 4G facilities. So you'll see that, and we can include that in the paper Councillor Duffy refers to around the criteria for booking pitches, depending on the level you're playing in, and if you're based there and haven't been based for a period of years. So we'll include all of that as well as send it out to members of this committee as well.
A couple of things, folks, and I'm mindful, Brian, but there's a couple of other councillors wishing to speak on this issue, and I'll add yourself, Brian, to that list. And just to say to Councillor Ferguson, Rachel, we'll come to your issue then, but I just want people sticking on this issue for now. Councillor Boyle, Michaela.
Chair, thank you. I do have, it's not on this, but it is an issue in regards to pitches. So with your indulgence, if I'd be allowed to make my pitch, pardon the pun, and it's just, I know I've wrote to Karen and Barry on this issue and it was widely publicised, but it's just the Meadows in Strabane and the rugby fraternity play on that pitch. I know council do not own that pitch. However, there seems to be an onus and a duty of care for those playing on the pitches, and it was brought to my attention and other councillors' attention in regards to the state of the pitch with dog excrement and glass on it. So I'm just wondering, because I know it will potentially be an issue once again over the summer months and over the months where the kids are playing and training on it. What is council's role in regard to that pitch? You know, Karen, I appreciate you did give me a very detailed response before, but it was raised with me there over the time I was out in the campaign trail on a way forward with that pitch, in terms of making sure that it's a safe pitch to play on, albeit I appreciate we don't own it. Thank you.
Through yourself, Chair. Yeah, we have a lease agreement, or had a lease agreement on that, and we will be bringing a paper in around the legalities around that, and in terms of possible developments of the motorway and things like that, and what would be wise for council in terms of extending the lease and that. So, in terms of that, that was a particular issue where a member of a visiting club and a member of the rugby club had complained about the state of it. So we have looked at, particularly in the Strabane area, around the stewarding and the staffing of those pitches, particularly at the weekend. So we have employed or recruited a number of resources and continue to do that over the next number of months. So they'll be doing regular pitch inspections and looking at things like that, and also things like rubbish, in addition to the referees of the leagues actually coming and inspecting the pitches as well. It's a common enough issue around many of our pitches, our council pitches, as members will be aware. There are very, very few of them have fences around them. They're open spaces and they're booked out. And in addition to our staff, the referees inspect them. So it's something that we can't really control when they're left open. We will do it on the morning of games. We'll check it after games, but issues could be arising the day or two before games. So what we do plan to do is that the new staff and resources we're employing around us will do more inspections, and that has been taking place in recent months around those particular facilities.
Thanking you, Barry. Alderman Devaney Morris.
Thank you, Chair, for allowing me in. And the previous speaker just stole me thunder and around the meadows because it was an issue that was raised on the doors with myself. But I take on board what Barry has said there and welcome anything that we can do as a council to have the ground meticulous. And I do appreciate the area where it says, and as Barry has stated, the issues in around it. But at least we're doing so. The rubbish, Barry, I'm just wondering, was there any more bins put in there, maybe to deal with rubbish or something like that there? But back to the booking of the matches and the training. For some clubs, there is some difficulty and around that there. And yes, look, it's disheartening for if an area has a pitch in its area or village or whatever it may be, and look, they have training to do, or maybe a junior match or something like that there the day before the Saturday match. I think now is the time to get these issues ironed out, and that look, we are using our pitches to our maximum, whether it be for junior matches or for training, and for the Saturday league it goes on as well. But look, they're very, very, very valid points raised. Thanks, Chair.
Thanking you, Morris. Councillor Tierney, Brian.
Thanks, Chair, for bringing me back on again. In relation to Councillor Duffy's question around the pitches and getting that information out, can we get that first of all for all codes, because GA is something that has been raised with me as well, that their short pitches, particularly on the West Bank, it's becoming more of an issue. So if we can get that for all codes, it will be very, very useful. And I appreciate. Pardon me. I appreciate Barry's answer around, what can we do? And in reality, of course, building more pitches is the answer, but that's not practical in terms of helping those clubs today or tomorrow or even next season. For example, the regional sub-stadium money is 34 million that's been ring-fenced. If we ever get an executive and get it out without going down that road again. But, we could nearly spend that money in Derry and Strabane and probably still wouldn't have enough pitches to facilitate everybody. In terms of the engagement, are we engaging, particularly around the regional sub-stadium stuff, are we engaging, and I know, Barry, you had done the pyramid in terms of the different entry levels for the regional sub-stadium stuff, but have we gone down into the local clubs to see if they have any plans or any aspirations they develop their own pitch, where we can maybe help them with an application if that fund ever opens? Have we done that? And in relation to, there was another thing I was going to say, just bear with me, it's left me. That's what I was going to say. In relation to what Sandra has asked around that piece of work, and you're saying you can get that very quickly, I think it would be good. I don't know if you've seen it or if you remember, but the play provision strategy that they've done within ENR, where they broke it down per DA, and then they've this pitch or this park is grade A, B, C, and we don't use this one no more, or it's been condemned or whatever. If we could get that smaller detail in relation to which pitches actually are able to be booked, and if there are ones that are there that aren't of a standard where you can't hire them or for whatever reason, can we get that information along with that piece of work that Sandra's done? Because particularly around that play provision strategy, it was really, really useful. They see exactly what is in use and what is available. I think that will be extremely useful, particularly in my own DA around the pitches. If that can be done as well, that will be certainly appreciated by myself anyway.
Yourself, Chair, and answer. In the first question, are we engaging yet? We've, in terms of any clubs that either own their own grounds or plan to own their own grounds from a soccer level, yes, we will be and have been engaging in those in terms of assisting, and members will be aware of some of the grounds that we own as a council and what is required to get to those to the next level. or whatever the criteria may be. And you'll see in our recent papers that we presented to members, a lot of those works that we're carrying out will assist with that. It won't fully comply. So as an example, Oakland Park and Derry, you know, to do X, Y, and Z, we're going to spend so much, it won't get it to the next level. But then when a fund opens, so we'll be working with our own and with clubs that are their own ground or plan to own their own ground. But the reality of it is most of them need to own their own ground and be ready for that and have security of tenure. With regards to your query on the grade, and all of the pitches that we have are currently booked out. So every pitch that we currently have actually is booked out. It's just how often it's booked out. So we will try. I'm not sure if we can get all of the information, but there may be some pitches during the winter months, during really wet weather, that might have 1 or 2 players rather than 3 or 4 a week. So we might have something like that. But all of the pitches that we currently have are all booked out. But it's just how often they're booked out during bad and really bad weather.
Thank you, Barry. Councillor Ferguson, Rachel.
Thank you, Chair. And I know it's under 105 and it probably would work with 104, but it's just slightly tying into it. Chair, in April's full council, I'd raised that Space 2 were trying to expand their sensory play with their non-for-profit, and was hoping that H&C directors could reach out to give them some help in finding what possible grants or funding that they could be able to access. I know that they're struggling at the moment, and they'd got in touch with me yesterday evening, and I said I would raise it again. Just I know officers are really busy, but just to kind of make them aware that any support from council or even links into the likes of Rapid would be appreciated for them to try and figure out how they can raise the £500,000 for their multi-sensory room. Thank you, Chair.
Thank you, Rachel. Members, is there any further items of matters arising in terms of the minutes? It's Thursday, 21st of April. Okay, moving on to item 8, and asking Barry to take this, please.
Thanks, Chair. Members, the purpose of this report is to update you on the findings and recommendations of the Rural Youth Audit, the Derrick, Spurn and Faughan DAs. Members, you'll be aware within the local growth plans for the 3 areas, a recent completed rural priorities report, the lack of youth services was identified as the first priority to be addressed and progressed. The growth partnerships discussed how best to bring this forward and was agreed to undertake an audit of all the youth issues in the 3 rural DAs. Fern consultant was appointed to carry out an audit of youth services across the 3 areas, and the findings from the audit outlines the potential to pilot shared community youth provision across the entire rural area. So members, in terms of the body of the report, you'll see in section 3 there that the Education Authority provide a level of float and support across the entire district, and it includes the 3 rural DAs. It does fund a number of area-specific youth workers in Faughan and Derg. However, there's currently no such supported provision in Spurn. Recent work undertaken in Spurn has illustrated the potential for shared youth provision across multiple rural areas, and the consultation undertaken illustrates high levels of cross-community collaboration between the rural community and the voluntary and youth organisations. So one of the key recommendations, members, was that from the findings was of the youth audit is to further develop a co-design mobile youth worker model with key stakeholders across the 3 rural DAs through resourced access and managed by the community and voluntary sector. The model would align with the forthcoming funding programmes, including Peace Plus and Shared Prosperity Fund. This provides an opportunity for the 3 growth partnerships to work together and explore funding opportunities along with Council and the EA. So members, in terms of the recommendation, that you note the content of the report and endorse the findings and recommendations emanating from this rural youth audit.
Thank you, Barry, and a number of speakers on this. Councillor Ferguson, Rachel.
Thank you, Chair, and thank you, Barry, for the report. I'm happy to propose it. I don't know if I want to endorse it. I think it's a great resource for us within the rural DEAs to highlight the lack of provision, particularly around the 23 youth workers and only 2 of them basically being within those 3 DEAs, and like I say, and one of the DEAs didn't have any at all. I think this will be a great tool for when it comes to Peace Plus, but I also think it shows the lack of service that the EA have been providing within these areas, and we as a council should be advocating very heavily that yes, there should be other funding streams explored, but the EA has a statutory duty to step in here. We have one of the highest areas of numbers of young people within our 3 rural DEAs, with the least amount of youth provision actually invested by the Education Authority. So no, I welcome the audit. I welcome it as a tool to make the statutory bodies step up to the plate and actually put on the services that they need to. I'm happy to propose it. I wouldn't necessarily say I would endorse it, but thank you, Barry. Cheers.
Thanking you, Rachel. Councillor Boyle, Michaela.
Yeah, thank you, Chair. And again, like the previous speaker, I welcome the audit undertaken by Fear and Consultant in terms of the Rural Priorities Report. The report itself is very in-depth, and it's no surprise that the Sperrin, Fawn and Derg areas are the areas that had under provision. It's something that we've been saying for a long time now. So it came as no surprise what was highlighted within the report. The fact that there was floating support across the entire district and it didn't include these areas, obviously was very glaringly obvious, because we've been saying for a long time, particularly in Sperrin and Derg, the lack of provision for youth. So we're being asked to endorse the findings in the report, and I'm happy to second Rachel in doing that. I hope that the new build that we potentially, hopefully are getting in the not too distant future, that the work that needs to happen will happen in and around the time, the co-design model, the youth worker model, through the different resources. That'll happen soon, and that the new build that we're expecting to happen we'll hear an announcement on that in the not too distant future either. So happy to second the findings and endorse them. Thank you, Chair.
Thank you, Michaela. Alderman at Devaney, Morris.
Thank you, Chair, for allowing me in. And look, I welcome the report coming forward here. And look, it came as no surprise to me when I read the report, when you look at the lack of services and provisions across the 3 DAs, and especially within my own DA, the Sperrin. But look, this brings it to a head here. We really know now where we need to put the work into, and those statutory agencies out there have to step up to the mark and deliver equality services for rural areas, and especially these 3 DAs. When we look at urban areas and the amount of workers and money is spent there, and all we're calling for, Chair, in the rural areas is equality across the board. And when you look at the figures, the number of is it 18,000 young people within the areas not getting full support from these different agencies. But Chair, just welcome a report. I welcome it that it has identified once again that what we've all known for many, many years, the disparity between rural and urban, the services being delivered to rural is not as what we would expect. But thanks, Chair.
Thanking you, Morris. Councillor Edwards, Stephen.
Chair, thanks for letting me in, and like others too, I welcome the report and the recommendations of the audit. And I think on a top level, Chair, that this report clearly identifies the discrimination that rural young people or rural youth are facing in terms of youth provision. Is something I've raised with them time and time again, that they're not active in the rural area, especially the Derg. And it's clear, Chair, that we do need to do more for them in terms of facilities and dedicated youth services. And young people do get a bad rap, they get a bad name. They get involved in some get involved in antisocial behaviour, but I do think Chair, that a lack of youth services does play a part in this, and I've raised this with the Education Authority. In terms of the DARE DA, the only facilities I'm aware of is in Castleberg High School, and there was some works that EA did last year, but I haven't seen much more than that happening. As raised by Councillor Boyle there, the EA does have plans for a new youth centre in Strabane. I hope that can give some provision to the Castletown area, which is in the DARE DA, and that Sion, Glebe and Clary's in the sort of catchment area for that. But ultimately, Chair, I think especially for the more rural areas, shared rural mobile youth services is a good idea. Spreading provision across rural parts of this council, and therefore I'm happy to support the proposal and thank the consultants involved in undertaking the audit and council officers as well. Thank you, Chair.
Again, you, Stephen. Alderman Hussey. Derek.
Thank you, Chair, and like others, I'm not sure that I welcome the report, but I acknowledge the report because it's a ratification of long-known deprivation indicators that I suppose us rural representatives have been highlighting since the establishment of the new Derry City and Strabane District Council. It's strange to call it new. And perhaps our city colleagues will realise we haven't been crying wolf. There is that shortfall in provision within the rural areas that has to be addressed. So the report's there. Moving forward, I'm sure that officers will be working with that report and working towards addressing the issues identified. Councillor Edwards referred to the only facilities that he was aware of, and indeed I was in my teaching days. I was head of a youth club that resulted in the development of the youth wing at Castleberg High School. It had its use had fallen back since the youth tutor at the school had retired, but I understand that situation has now been resolved, and the youth wing will be more functional and the youth club at that location. But I would also remind members that there are numerous youth organisations, particularly uniformed youth organisations throughout our rural areas, and they deserve support as well to enable them to provide services for our youth. There are the, I suppose, statutory or voluntary youth organisations which sometimes don't appeal to some or to all youth, and then there are the drop-in type youth clubs and youth centres that are needed, and they provide for those for whom the more recognised youth organisations don't provide, but they all have to be in the mix and provide that cocktail of provision that will ensure proper consideration of the needs of our young people throughout the rural areas. And another issue within that, and it will be addressed, I'm sure, is transportation. The rural area, getting our young people along to where the provision actually is. Thank you, Chair.
Thank you, Derek. Councillor Tierney. Brian.
Thank you, Chair. Almost afraid to speak, but I want to be very clear that this and my comments on this is not to try and make this urban versus rural by any stretch of the imagination. But what this report tells us is that EA, the body with statutory responsibility, are not providing enough service within the rural DAs. I fully accept it. I welcome and acknowledge the report, and anything that I can do to try and advance it and try and ensure that we are lobbying for better services within the rural DA, I will absolutely do, without shadow of a doubt. But 2.1, within the local community growth plan of the 3 rural DAs which are named, and the recently completed Rural Priorities Report, the lack of youth service was identified as the first priority to be addressed and progressed. If that report was an urban priorities report, the outcome would be the same. Because the reality is, whether you're in urban or in rural, there's not enough youth workers, there's not enough provision for youth workers in either setting. And I think that's something that we have to recognise. Whilst I appreciate that there are more And it may look to someone who has got no provision that those of us in an urban setting have got loads of provision. There's still not enough. And I think that that's something that we as a council need to address. I would like to see an urban priorities report around the provision of youth services, because I know in my own DA that there isn't enough. There's absolutely not enough. I also would like to point out that whilst I understand that this was very much aimed at the rural DAs, Culmore is a rural village. It's in the Ballyarna DA. It has got next to no youth service provision at all. And it is understandably left out of this report. I appreciate that. But it's still a rural area within this council district. It still has got very, very little youth service provision within it. It has got, I would be afraid to guess how many children within it. Do you know some of the young people in Alderman Hussey, I think it was, addressed transport? Do you know some of the young people in Culmore had to get a bus from Culmore to Pennyburn Youth Club to be able to use youth service? Now, I know to some people that may not be far, and it may not be a big thing, but it's a blocker for some young people in Culmore to go to a youth club because they don't have one within their own area. So some of the issues, and I fully appreciate the issues that those councillors who have already spoken, and as I say, I give my full support to this report. Some of the issues that they're facing, some young people within urban DEAs on the periphery of an urban DEA are facing as well. And those of us who are in areas where there are, or it may seem to be, have plenty of provision around youth services. There's not. And that's the reality. And I would invite anybody to come under the Ballyarna DA and examine it and look at it. I give my full support, as I say, to this report, but I think it would be unfair and I wouldn't be doing my job right if I didn't highlight the fact that I would say that every DA across this council district has an issue with the lack of services. And if we're going to reflect anything to EA, I think we have to reflect that we need better services, we need enhanced services, and we need better provision of services in all of our DAs. I have no issue in starting, if they're going to try and address that, I have no issue in starting where the area of most need is, and it's clear from this report it's in the rural DA. But just because there is provision within the urban DAs, they shouldn't be ignored if we are lobbying EA for better services and better provision. But as I say, fully support the report, acknowledge Councillor Edwards has spoken adequately, someone who is in a rural DA on behalf of our party, and explained where we are coming from it. But from an urban point of view, I think we can't ignore the lack of provision within urban DAs either when we're talking about the lack of provision around youth services. Thank you.
Thank you, Brian. Folks, the item's been proposed and seconded, and everybody has spoken in support of it while also outlining all our priorities. Thanking you, folks. Moving on to item 9, and again, ask Barry, please.
Thanks, Chair. Members, the purpose of this report is to update you on the consultation response to be submitted in relation to the draft form of adult social care for Northern Ireland. Members, you'll be aware that the Department of Health is undertaking a consultation on the reform of adult social care in Northern Ireland and the related equality impact assessment. This policy will provide a framework for adult social care as it is a vital part of our health and social care system and impacts on the lives of people across society, including people who use social care services, family carers and people who work in social care. Members, prior to submission of a formal consultation response, Council was invited to join in discussions with AGNI in relation to the reform of adult social care. The age-friendly officer represented Council at this workshop on Thursday, the 14th of April this year, and a copy of the draft reform of adult social care for Northern Ireland is available on the Department of Health website. You see that in section 2.6, members. The consultation process opened on the 26th of January. The original closing date was the 18th of May, but this has now been extended until the 1st of June. So in terms of the recommendation, members note the content of the report and appendices and endorse the draft consultation response to be submitted to the Department of Health. Thanks, Chair.
Thank you, Barry. Anybody on this, folks? Councillor McGinley, Emma.
Very good, Chair, and thank you, Barry, for the report. On behalf of Sinn Féin, I'd be happy to propose the recommendations within the report. You know, from a Sinn Féin perspective, throughout the consultation, there's a few issues that we wanted to see addressed, and we'll be submitting as a part of our response to the same consultation. But in terms of the council's response, a lot of what we're looking to see coming out of the other side of this reform plan is within the council's response there. So we're happy enough to endorse and to support the draft response there that's been in.
Thanking you, Emma.
Happy to second.
Thanking you, Councillor Farrell Rory. Proposed and seconded, members. People happy enough to move on. And if I could move on to item 10, please, and ask Seamus to deal with the affordable warrant scheme.
Thank you, Chair. And the purpose of the report is to update members on the proposed changes to the number of referrals that can be made to the affordable warrant scheme this financial year and funding implications for Council. Members, you'll be aware that Council and the Northern Ireland Housing Executive have been delivering this scheme on behalf of DFC since 2014. DFC has notified councils of their budget for this year will be approximately 16 million, and the number of referrals submitted by councils will reduce from 30 to 20 per month from June this year. As councils are paid per referral, this equates to a reduction in funding to council of approximately 22,000. Members, the demand for the affordable warrant scheme remains strong, and a report produced by the Department of Finance makes a number of recommendations on the future funding model and administration of the scheme. DFC is currently reviewing the report and the recommendations contained within it, and a further update will be brought to this committee. The report also outlines other fuel poverty assistance schemes which council officers signpost applicants. Members, as outlined in the report, council is anticipating a reduction in funding. However, the deficit will be approximately 7k rather than 22,000 due to the accrual of 15,000 from the 21-22 grant. And it's recommended members note the content of the report and council continues to deliver the scheme.
Again, you, Seamus. Councillor Farrell Rory.
Thanks, Chair, and thanks, Seamus, I think, for that. I can't get my head around this. I am genuinely struggling to find the logic in this decision that was made by the Department for Communities. So we have a cost of living crisis. We have a situation where gas and oil prices are going through the roof and people cannot heat their homes. And we have this affordable warrant scheme, which is meant to make it easier for people to heat their homes. You get new boilers, new heating systems, new windows, insulation. And instead of increasing access to this scheme, and instead of increasing funding for this scheme, and instead of investing in the scheme, they're doing the polar opposite. They're reducing the funding, they're cutting the funding, and they're reducing the number of people who can avail of this scheme. And in our council area, we could make 360 referrals last year. This year, it's 260. So that's 100 people and households that are left in the cold, literally. So I think it's an absolute disgrace. I think the Department for Communities should be doing its utmost to try and increase access to this instead of restricting it. So I'm not sure what we can do about this. I would like to write to the Department of Communities and say, we are totally against this. Ask them to review this because it's an absolute joke. The only thing in the news is about the cost of living, about the cost of gas, about people struggling to pay bills, to decide whether to heat or eat. And this is something tangible that can make a difference. And instead of increasing access, opening it up, they're closing it down. It's a joke. So I would say that we do not accept this. We write to DFC and say, hang on a minute, are you actually serious? Probably word it differently, but it beggars belief. I don't get it. I don't get it at all. Thanks.
Thanking you. We have a couple more speakers. You look at them, Brian, too. I was just going to say, Rory, if you could type it up. Okay, thank you. Councillor Boyle, Michaela.
Thank you, Chair. I suppose just in terms of the affordable warrant scheme, I want to commend the council officers for the work they are doing to date on this and what they have been doing through the years. I suppose it's a victim of its own success. A lot of people looking to replace boilers and get insulation into their homes as a result of this. I want to commend the DFC for what they've done down through the years in terms of planning for this and putting funding towards it. And I'd just be mindful for Councillor Farrell to read 2.2, where DFC has said, in the absence of an executive, it is not possible to set the budget for 2022-2023, and this is why they've had to roll back. It is unfortunate. I would also say to Councillor Farrell that, you know, his anger should be with the DUP also, and there's £300 million there to address the cost of living that needs to be put out into people's pockets, and in the absence of any form of government to get that money out, and the demand sitting there for that money to be used and spent for projects like this. So it is, in terms of going forward, the refusal for other party, the DUP, to enter into government is holding this back also. So just to say that, you know, it is what it is in the report. I, like other elected representatives, have had constituents come to me looking to support them in their applications for it. Council, I suppose, can only do and work with what they have. Hopefully, in the not too distant future, we'll see some sort of a government in place, and hopefully that 300 million will get to the pockets of people that need it most, particularly for projects like this. So thank you, Chair, and I hope that when this does get sorted, that the budget will be set, and the 16 million that is there, the capital budget set for this, will go in some way to help a lot of people heat their homes, because that is one of the biggest single issues that we have heard on the doors, is heating homes and feeding children and families. So thank you.
Thank you, Michaela. Alderman Devaney Morris.
Thank you, Chair, for allowing me in. And look, I have to say, I'm really disappointed in the report here, but I want to put on record our party's thanks to all those officers who have delivered this programme over the years and delivered a very good, slick operation. Look, it's all in around funding, and as the figures quite rightly say, you know, we're able to afford 360 households, we're down to 260. You know, as quite rightly stated by Councillor Farrell, that's 100 less. And look, I know Sinn Féin will be ironing out, you know, about setting up in government. Nobody knows what's going to happen until tomorrow. I would just to put that in record. And look, at the end of the day, this is their minister that made this decision. And look, at the end of the day, we are disappointed, especially in the climate that we're in at the minute. You know, the cost of living, the cost of fuel, the cost of everything. And I would expect that this programme to be enhanced to help those people out there to have, you know, better installation, better windows, and better boilers to heat more economically than some of the old boilers who we know are not economical. But look, just to put on the record, Chair, we cannot support this recommendation here going forward. But I do see the proposal by Councillor Farrell here to write to DFC around the disappointment of the reduction of a number of variables. We would have no problem in seconding that proposal, Chair. But thanks.
Thanking you, Morris. That has already been seconded by Councillor Tierney, Brian. Alderman Hussey, Derek.
Thanks for the opportunity again, Chair. Like Councillor Boyle, I do have to congratulate officers for this, for continued operation of this scheme. And as she rightly says, it perhaps is a victim of its own success. And the more successful it is, the more people who want to join into it. It's regrettable. If not, well, I could use another word for by regrettable, the reduction of the number by 100 at a time like this, as others have outlined. The scheme is a targeted scheme on specific addresses. Previously, I'm aware of postcode areas where the targets were, and it's set by DFC. Is there any indication of what areas are being targeted on this swathe of the programme going forward? Do we know the areas that are going to be targeted? And secondly, will the rising costs, whether it's plumbers or whoever it is that will be carrying out the work, will rising costs impact on the number of applicants able to be assisted? Thank you.
Thank you, Derek. Seamus.
Through your chair, yeah, Alderman Hussey, it is a targeted scheme, and Council is provided with a spreadsheet of addresses that letters are issued to. The targeting of the scheme has presented difficulties in terms of there had always been an 80% that councils had to stick to. 80% targeted, 20 non-targeted, and they were urgent referrals, for instance, boilers broken down and properties with no heating. What I have noticed in terms of the Department of Finance report, there's a recommendation that the funding model is reviewed, and that also the targeting mechanism is reviewed and the percentage reduced to 60% targeted and 40 non-targeted, which should make it available to a wider number of households. And it's probably important to note that year on year, the funding has reduced. The number of referrals that councils can make has reduced, and that has been linked to the targeting of the scheme.
Thank you, Seamus. Councillor Harkin, Sean.
Yeah, look, we want to add our voice to the frustration about the reduction in terms of budgeting for this scheme. I feel like we did a lot of work trying to improve this scheme from the council point of view, working with the DFC. I felt at times they did listen, and there's definitely a huge need for it across our district, and that was prior to the cost of living crisis. And back when we were having those discussions with the DFC, it was about how do we climate proof houses as much as possible. Now it's climate proofing and it's the cost of living crisis. So I mean, it just feels like we did a tremendous amount of work to squeeze as much out of this scheme as possible for our residents, and now there's a big movement backwards. And I do commend the work of the officers, because this is not an easy scheme to administer. There's a lot of work that goes into this because of the nature of it. But we were really trying to get as much out of it as possible for the district, and we were exceeding, it seems to me. So I would say, look, that I completely agree with the proposal. I think we do need to go to the DFC and say this is not acceptable. It should be revisited. I think we can say both that to the DFC minister, that we disagree with this decision not to put a budget in place that allows us to expand the affordable warmth scheme, and also say at the same time that the DUP should be, and other parties should be, respecting the democratic mandate. They allow us to get on with things. So totally endorse the proposal. I think we have to express our frustration on behalf of our residents and people who were hoping that their homes could be improved in terms of warmth, where they could save money and where we could have an impact on climate change as well. Thank you, Chair.
Thank you, Sean. Thanks. Members, the proposed.
Chair, thank you for bringing me in. In relation to this, first and foremost, I have a question. And it is, do I not recall a paper coming before this committee a while back where other councils across the north were unable to fulfil all of their referral positions, and we were at that stage seeking more. And if that is the case, what happened there? Because rather than seeking more, we ended up with less. So if we could get an explanation around that, I think it would be useful. I obviously seconded the proposal. I don't think we should be accepting this. I don't think it's fair that government just think that they can cut things and just send a letter, and we're just supposed to nod and smile and say, oh, well, thank you very much. This is a very, very important and very valuable scheme across this council area. So I think we should be definitely writing and telling them, not asking them to reinstate it, telling them we're not accepting what they're offering, and then get into some sort of negotiation. But I think it's important that we understand around the councils that aren't fulfilling their proportion, because there's obviously scope there in terms of the 16 million. And just on I suppose, an observational point throughout this meeting, the DUP have been disappointed around the unison deputation, the fact that there's no government and nurses are going to banking and leaving the NHS. They were disappointed around EA and the rural provision around youth services. They were disappointed whenever I mentioned around the regional substadia stuff, and they're disappointed around this fund as well, and the cutting of it. It's very, very simple. Get into government and do something about it. Thank you.
Okay, Brian, thanking you. Okay, folks, this has been proposed and seconded, and I haven't heard any. In fact, I've heard people speaking in support of it. So unless anybody's against it, we're going to take it as unanimous. Okay, thanking you. Okay, members, can we come back here for 6:10, please?
and the requirement to obtain council approval of the service plan. The plan outlines how council will comply with these duties by carrying out inspection programmes based on risk, investigating accidents and complaints, and other activities such as event safety, sports ground safety, and construction product safety. The environmental health team will primarily provide advice and guidance during their inspections, but on occasions, enforcement action may be required in accordance with the council's enforcement policy. The chairs recommend the committee approve the service plan for this financial year.
So proposed.
Seconded.
Thank you, Chair and members. If you bear with me, there's a lot of content in this report which I'll try and get through. So the purpose to review public convenience provision in the council area, and members, you're aware from previous committee papers, member-led working groups and member briefings held in the past that the council has a small number of standalone public conveniences which have remained closed during the pandemic. Following a review in 2017, there's been substantial progress made in relation to ensuring hygienic, safe and accessible public conveniences across the council area. And this has been achieved by the implementation of a community toilet scheme, with currently 20 businesses participating and a number of applications pending. There's also been the rollout of change in places facilities, 7 currently in place with 2 pending. And this will be enhanced due to recent changes to building control regulations for certain categories of new buildings, which will require these facilities also. The current public convenience provision is supplemented by approximately 30 other public conveniences located within the council-owned and community buildings and leisure facilities across the council area. Standards of hygiene in these premises generally higher due to regular cleaning, service and supervision arrangements. Discussions continue with a number of additional local businesses which have expressed an interest in participating in the community toilet scheme, should council wish to expand the scheme. Alternative provision has now been identified in Dunnamana and Cyan Mills. Therefore, it is proposed to keep the standalone facilities in these areas closed. It's also proposed to keep the facilities in Strabane closed, as they will be demolished as part of the public realm scheme. An alternative provision is available in the Alley Theatre and Strabane Library and other local businesses. Members, council officers have had discussions with DERA, Inland Fisheries and DERA Policy Unit, who have advised that the facility located at Murlock was provided by the Rivers Agencies in the 1980s, but is no longer on DERA's asset register. DERA has also confirmed that it does not provide public conveniences at any other Inland Fisheries public angling estate facilities, and it does not have a budget to maintain or replace the existing facility. It's important to note, members, that DERA nor Council is in ownership or in a lease agreement for the lands of Murlock, therefore presenting a potential legal and financial liability for Council and DERA. A structural and condition survey has been completed of the toilet facilities at Murlock, and due to significant defects, it would cost approximately $55,000 to replace. DERA has suggested removing the toilet block and have agreed to facilitate this. As it has not been possible to identify alternative provision for the community toilet scheme in Plumbridge, Cranagh and Barnes Gap, it's proposed to retain provision at Barnes Gap, which is linked to the Appalachian Trail. It's also proposed to retain facilities at Plumbridge, which service the local town, and it's proposed to close the facilities at Cranagh, which Council has a lease agreement with the church dating back to 1982. Discussions in relation to Cranagh, discussions are ongoing in relation to the future of the former Spurn Heritage Centre, linked to the Spurn Sculpture Trail, and this may permit additional provision of this location in due course. The report also outlines future proposal for the former public convenience at Newton Stewart, which has been closed for a number of years. And members, Council also facilitates the hire and payment for temporary toilet facilities, and members are asked to consider whether these facilities should be provided to groups where other sources of funding are not available. Members, the report outlines the financial implications, including the substantial saving to Council implementing the community toilet scheme and promoting the use of other public and council-owned buildings rather than standalone public conveyances. The additional cost implications associated with reopening all public toilets include refurbishment costs of approximately 122,000, which will need to be identified from year-end outturn savings. There's also additional budgetary provision of 55k for staffing costs to enhance service provision, which will require consideration as part of the 23-24 rates estimates process. And also there's a budget would be required potentially for the purchase of vehicles. And the replacement, as I mentioned earlier, of the toilet block at Murlock is estimated at about 55,000. The additional expenditure requirements, which are not included within the 22-23 rates estimates, will have significant onward implications for an already challenging 23-24 rates process. If Council decides to provide a facility at Murlock, there will be financial and legal costs associated with agreeing and servicing the lease on the lands. So members, just to recap on the recommendations, it's recommended that members agree to retain provision of public conveniences at Plumbridge and Barnes Gap and refurbish these facilities at an estimated non-recurrent cost of 14,000. It's also recommended to permanently close public conveniences at Crana, Dunamana and Siam Mills and approve the inclusion of alternative provision at these locations where possible within the community toilet scheme. It's also recommended Council permanently close the public conveniences at Strabane, which are due to be demolished as part of the public realm scheme, and liaise with DAERA regarding the removal of the public conveniences at Murlock. It's also recommended that Council continue to facilitate the hire and payment for temporary toilet facilities for community events that are not in receipt of funding and consider opportunities for community asset transfers of those public conveniences that are to remain closed prior to sale or disposal of the land. Thank you, Chair.
Thank you, Seamus. Councillor Edwards, Stephen.
Chair, thanks for letting me in this issue, and I know that the issue of public conveniences has been an ongoing issue for Council, indeed since I've become a councillor 2 years ago. And I want to say, Chair, from the outset that this is a very difficult issue to deal with in one committee paper. Each of these sites are very different and they probably need their own specific paper to give them proper and full consideration. Chair, I just wanted to note that on the outset, and please bear with me as I go through the issues I have, Chair. I've been full circle on the issue of public toilets. I've supported the deployment of the community toilet scheme in Castlegar, and I've also understood the financial implications we have in reopening their toilets and cleaning expenses and so on. I've also, Chair, been engaged in discussions in Newton Stewart around the community acquisition of the old toilets there, but have been closed a number of years ago. But Chair, especially over recent weeks and getting out and getting canvassing, and in all honesty, I've gotten to know of the value of public toilets for local residents, for visitors, and for those travelling through our various rural towns and villages. And during the election campaign, I've been to Beara, Fitna and Trillick, using their public toilets, Chair, which are all and they would put our council toilets to shame. They're all in good, very good condition. They're very new, they're very modern. And indeed, Chair, I went on to Fermanagh and Omagh Council's website and I see that they have opened 30 public toilets in rural areas throughout their council area, Chair. So that's my first thing. Like, why should we be rushing into closing rural toilets when our neighbouring council area has over 30 that are open to the public, Chair? And I know that being part of the Public Convenience Working Group, Chair, as well, that Council doesn't have a statutory duty to provide public toilets. But in my view, for many of these rural areas, the public toilet is one of the very few council services that they actually can see in their village, Chair. In terms of the recommendations in 5.1 as well, Chair, they're not easy decisions. I'm aware that they've been going on for a number of years. But as a DERG councillor, I do have huge concerns about Siam Mills being proposed for closure. While I understand that a business has been identified for the community toilet scheme, I'm not too sure what that business are or what their hours of operation are. I have reservations around the lack of community consultation on the issue, Chair. The public are not aware. I speak to the public. I spoke to the community groups. They're not aware that this decision is before Council tonight, Chair. The Sion site is right in the heart of the village. It's adjoining Devine's Butchers there. It's my fear that should these toilets be closed permanently, that they will fall into ruin and a state of disrepair and become a permanent stain on the main street of Sion Mills, Chair. I understand that a community toilet scheme has been identified, but if you were to go by the experience of Castlederg, Chair, it doesn't instill much confidence for myself. Castlederg's public toilet was closed. We had a community toilet scheme in place, I think, of 4 businesses, and we're also promised a change in places facility. But the community toilet scheme hasn't been properly promoted, in my view. It's only saved for the fact that Hamilton Spire has underwent a recent renovation, and the new change in place facility hasn't gone ahead in their Valley Leisure Centre, Chair. I'm also aware that, speaking with colleagues, that there are concerns around the closure of Dunnamana. I'm also, and the lack of consultation in the public in Dunnamana. And I also received emails, Chair, as probably have other members of this committee, from the Glenelly Trust regarding concerns around Crana. And given this backdrop, Chair, I want to propose a deferral of the permanent closure of Dunnamana, Crana and Seymour's public toilets with the view of more engagement with the public on the issue. I think that the decision to close these toilets today is unfair, given the lack of public knowledge on it and the lack of public engagement, Chair, especially for Seymour's and Dunnamana. And Chair, I know that budgets are tight and financial pressures are very real, but it is important to remember, as I said previously, that our rural communities pay the rates also, and they don't have the luxury of availing of local leisure centres, city baths or sporting facilities. So I think they're due some special consideration here, Chair. And I'm going to conclude my remarks very soon, Chair. An issue is Strabane public toilets. They are an eyesore. I've no issues with the current ones being removed as part of the public realm scheme. Strabane it is a built-up area. There's lots of pubs and library with change of place facility, as Zowie Theatre there, as mentioned in the report. But I do think, hopefully after the public realm scheme goes ahead, I do think we should come back and look to see if those provisions that are there are actually doing their job, and to see if there is any need for further public toilets in Strabane town. And on a final note, Chair, I just want to mention Murlock. It is a responsibility for DERA, but they look like they're unwilling to engage on the issue. But Chair, I just want to raise, I've been to parks, especially over lockdown, that are have public toilets, that are DERA run, have public toilets. So I'm wondering what sort of engagements they have in place. But I think ultimately DERA are responsible for Murlock, but I don't hold out much hope that they'll provide facilities there, Chair. And as I said at the beginning of my contribution, I think these issues are big, and and I do apologise for the length of taking here, Chair, but I thank you for your indulgence. I do have a proposal there, Chair, if I can put it into the chat box for you. Thank you.
Thanking you, Stephen, and I have a number of other speakers which I'm going to go to, and I see your proposal in there, and obviously, given the fact that it is a fairly comprehensive and detailed issue, but I'll go on to the other speakers and come back to the proposal. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in. And look, I know this can be a difficult issue sometimes, but you know, it's one of the luxuries that some of these rural villages has is their public toilet schemes. And look, and specifically pointing to Dunnamana, I know I got it on the door very, very clearly around keeping that facility open. And you know, I remember being in it previous just to campaigning before the last council elections or local government elections. And I will tell you, it was a no-fit state. And look, it's a good building. All it needed was a bit of a tidy up and a maintenance and some bulbs put in. But Chair, it's one thing. And I take on board and around Dunnamana, there's talk about a community toilet scheme. I would ask officers maybe to go to some of the businesses someday and stand for a day or two and ask anybody coming into that business, are you aware that this business here is facilitating a community toilet scheme? I can assure you the percentage would be very, very low. And take Donamana, Chair, it's one of these areas, yes, there's a mart in it 2 times a week sometimes, yes, and I do understand that there are toilet facilities within the mart, but when you take the broader area of Donamana, and you know, some of those vehicles and tractors and trailers coming with animals to the mart are maybe nearly almost half a mile away. And look, I do believe that in these instances, you know, really, if we pointed out one business that was signed up to the community toilet scheme, would you want 20 farmers walking in and upstairs with their mucky wellies and clothes? You know the odor that comes of sheep farming and cattle farming and all the rest. Would you want that in through your business? I don't think so. And I'm very supportive of the issue of deferring the items here about the closures. There are some, look, we have very little control over as Marla, and I understand that is an issue for DERA. And look, my argument would be that I believe the one in Donamana is one of the ones that I would be arguing to keep open. And look, all it needs is a tidy up and a tidy round there. But look, happy to support the proposal. I know my colleague maybe has seconded it there, but happy to support that proposal that we defer this for further information. But Chair, as the previous speaker said, you know, our rural dwellers always say, what do we get for our rates? We get our bin emptied, we get public lighting, and we don't, you know, those where they have public toilets, they're now closed, and they've been closed for well over 2 years, some of them longer. I know some of them have been closed because of COVID, but as we move out now, I believe we need to instill confidence in our rural community and opening these toilets and opening there. Because, Chair, I want to just finish on this. We have a community play park, a good facility play park down at the recycling centre. And I know that there are many bus loads of children and groups come to that park to play. And if they have to go to the toilet, the minibus knows when times were good to get them into the minibus and take them up to the public toilet, not having them walking up the main street because there is no facility down and near the play park. And that's why I would be arguing strong to have the one in Donamana open. Thank you, Chair.
Thank you, Morris. Councillor Boyle, Michaela.
Thank you, Chair. I would be happy to support or Sinn Féin as a party. My own party would be happy to support the proposal by Councillor Edwards to defer the closure of the toilets in Donamana, Sion and indeed Crana until such times we get a reference in terms of what we need to do in terms of the local community toilet schemes. I know it can be quite difficult in rural areas. I'm not alone. I received a letter from the Glenelly Development Trust about the issues that they have raised in terms of Plumbridge and Crana. And we can't, I suppose, ignore the issues that they have raised within that letter. I know they have met with council officials back early in May. There has been a bit of an uproar in the Glenelly area in terms of the closure of the toilets. And coming from a rural area, I can understand that. It's not as easy to get a toilet scheme in a small rural village where you may only have one facility in terms of a chip shop. And these austere times, I know a lot of those facilities have had to close. Pubs are finding it very difficult to stay open 7 days a week, 5 days a week, 3 days a week. So that's the issues that are being faced in the rural areas. But I think I just want to make a comment. You know, we're happy to support the deferral. I would even go further to say that I think there should be a specific meeting in regards to this issue with elected members and those interested in discussing this issue further. I think we should have a specific meeting outside of this committee just in regards to toilet provision. But when you look at across Europe and how we allow people to spend a penny, pardon the pun, there are other advantage ways that council can make toilet provision or public convenience provision more amenable to the public, and that would serve a council very well in terms of financial gain. When you look at across Europe how they do it, and you pay for spending a penny literally. So I mean that's not for this meeting, but that's something maybe further down the road we have to look at. But I want to just put on my gratitude to the council officers and the work they have done in terms of the change in places toilet facilities to date in our council area, particularly in Strabane and the Alley Theatre. I think that those facilities go in some way to make up for us not having our public convenience opened in Strabane. I also want to just pay cognizance to the fact that and I know it's in the paper, signposting people and signage. That is something that we have to work on ASAP. If you arrive, we are in a tourist friendly region. We're very presently placed, in a border town of Strabane and indeed Derry, where we have people coming to visit our areas. We're a tourist friendly region, and I think we need signage for all of the public conveniences or public toilets. My apologies, the cat got on and the dogs are barking. So I think just in terms of going forward in this, there are some issues that I do. The fact that Murlock, and we see it all the time, Murlock is now going to. I think we need to liaise better with DAERA in that regard, to see what other provision is going to be there, and I think also in terms of additional information to people. There's a lot of people just don't look at the app. They want to see signage in a town that they're driving through where their community toilet is. So I think that's something that needs to happen pretty quickly, for people to establish where they can actually go to see where there is a public convenience provided for them, other than a toilet, a public toilet, if it's in a pub or a restaurant or a theatre or a library. They need to have that information at hand. So we'd be happy to support Councillor Edwards' proposal and a deferral, so that we can get more time to look at what we can do beyond that, and what other measures we can put in place in those areas, Dunnamana, Sion Mills and Crana. And again, I want to thank the officers. The cycling fraternity did contact me last year in regards to the toilets in Crana being closed. And just to put it on record, it's the only toilet this side of the Sperrins, and the cycling fraternity do use that toilet often. And I know in terms of cycling Sundays and that kind of thing, the toilet was open for them, and gratitude for that to council. So thanks very much, and that's just a point I want to make. Thank you.
Thank you, Michaela. Alderman Hussey, Derek.
Thanks, Chair. I've had to change device here. For a while there, I was out of the conversation, so if I'm covering ground doubly, my apologies. I suppose a major element in our toilet provision is matching the toilet location with where the critical mass of people may be. And a point has already been made there with regard to, I think it was Alderman Devaney, an awareness of where the community toilet scheme is, and the issue of signage, etc. That's an issue which has been raised regularly with regard to Castlederg. And, I go about the town, and I don't know, if I didn't know personally where those toilets were, I don't know how a visitor would have a location as to where they might be. I think there's an issue, and we've seen this issue. I think it was yesterday with regard to the removal of back alley lights. It's not the issue of removal. It's what are you going to do to replace that? And sometimes I think we're putting the cart before the horse. We should have the alternative provision in place and working before we say we're removing. And that issue of community engagement is absolutely vital. And I do welcome in that respect the proposal from Councillor Edwards that there should be that community engagement to ensure that there's community contentment. Within the report on 3.3, at the end of a long list of items, I noticed cemetery provision is included there. And at some stage, could somebody perhaps update me, and it may be an E&R issue, but with regard to the toilet at Castlederrick Cemetery, it was closed during the pandemic and has got into a terrible state. I'm not exactly sure what's happening there. That would need to be addressed. And another issue within toilet provision, and I suppose I think it was maybe Councillor Boyle who referred, or Councillor Devaney, I'm not sure, maybe Councillor Devaney, the issue of children attending the play park in Donamanna and the bus taking them up to the toilet that exists where it exists at present. Well, I've highlighted several times that the similar issue that exists at Castle Park, and there had been intimation that there was the potential for a new toilet block to be provided close to the entrance at Castle Park, and there are desires that the park will be upgraded to district neighbourhood park status, and that would be a requirement. And I hope that that's something that Seamus and his department are taking on board, together with other responsible departments on the issue. Thank you, Chair.
Thank you, Derek. Alderman Kerrigan, Keith.
Thank you, Chair, for allowing me in. And Chair, to be fair, the majority of speakers have went over various issues which I was going to raise, but do concur with the remarks there, particularly made by Alderman Hussey there, in regards to, I know it's cross-departmental on our end here with the E&R Directorate and our own there, but it was my understanding as well that we would have the castle site in Castlederrick, the play park, upgraded from a local play area to more of a district one, which I was under the understanding that toilet provision would be there. And again, I was hopeful at some stage, I suppose it's touching into the Spairn DA, but the Vaughan's Home in Newton Stewart could have been something similar. You know, and that would have maybe resolved issues in regards to lack of toilet provision in Castlederrick and Newton Stewart. But no, Chair, I was content to second Councillor Edwards' proposal. As I say, I think it's something there. And another wee factor I was just going to touch, and I did raise it with officers at the stage. You know, it seems quite a high cost there involved in the maintenance issue. It seems to be that as the 1920 figures there. Could that be something that could be put out to tender potentially if we did have these sites operational again? I feel that you know, we could put that out to tender potentially and see, you know, could some outside source do that even on a temporary basis, and if it was up to standard, that it could be done in that regard. Because I know issues were raised that we didn't have capacity, and I'm linking again across directorate here. An issue was raised in regards to play parks, in regards to key holders and getting play parks open in the morning and closed in the evening time, and there was issues with that. And again, I was told, and the legacy of the old Derry City Council, whereby there were park rangers that did that role, whereby there wasn't the equivalent. And I sort of thought, you know, if you did have individuals, should it be council officers or should it be a subcontractor in through council that could, you know, the only one I can think of off the top of my head is the new play park in Mourne Park there. There was issues in the past with key holders, and you know, whereby you could have an individual sent out to open toilets and open play parks and go around in the evening time and close them again and clean and make sure they're up to suitable standard. It seems quite a high figure of well over £100,000 there. And again, I'm just thinking of cost saving as well in that one. But no, I just again, and as touched on, Michaela has touched on it there as well in regards to tourism and in regards to cyclists. I mean, we've had a couple of run there in recent days up to Mahrafelt, and you know, that's my route. You know, it was up through Crana, and you know, you see it, and you're far from everywhere up in there. You know, it's a lovely part of the country, and you get a good day. It's beautiful, but it's you're a right distance from everywhere, and I mean, there's realistically no businesses up in there, and to get that, you know, there's no alternative for the community toilet scheme. I see. I do understand there's one up in Park there, whereby it's a community centre are involved in it. But it's or maybe that I may be wrong there. Maybe they didn't qualify for the scheme. But it's the case there, Chair, that signposting it as well. And I say I know there's 4 businesses or 4 organisations and groups are signed up to it in Castle Derg, the community toilet scheme. But if you asked members of the general public, they wouldn't have a notion who it was. You know, it's that difficulty. And again, it's not often the young people that are tech savvy who are looking it up on their phone to say, oh, I can go to the Spar, I can go up to Churchtown Community Association, I can go to the Co-op, I can go to Jack's Coffee Shop. You know, it's older people, and sadly to say, needs must at that stage, and they don't have time to try and find out. You know, so it's just that. But no, I think, to be fair, the other speakers have covered most of the points for me, Chair. Thank you very much.
Thank you, Keith. We have a proposal from Councillor Edwards, seconded by Alderman Kerrigan. And just to note as well, Alderman Guy has written under the group chat they're happy to support the proposal of deferral. So, folks, I haven't heard anybody speak against this. So, unless anybody does in the next then the proposal passes. Okay, thanking you.
Chair, could I just come on there, Councillor Edwards? Sorry. If you can hear me, Chair.
Yes, Stephen.
So yeah, our proposal deals with the bullet point 2 and 5.1, but is it my understanding that the other proposals there will go ahead in 5.1, Chair? Thank you.
Councillor Edwards, Stephen, I didn't actually catch that, so maybe just. Hey. Right, okay. Okay, is people okay with that? Okay. Members, the next number of items are for information only, but if anybody wants to address any of them, then if you let me know now, either in chamber or on the chat box. Councillor Ferguson, Rachel, item 15.
Thank you, Chair, and thank you, Seamus, for the report. Chair, this is one that I'd raised obviously with our animal welfare issues within the council. That was some of the concerns from the charities and some residents that brought them up to me. Now, I welcome the report, and it does explain our service level agreement, but it does still leave me with some questions. For example, the service level agreement is 7 years old, and it doesn't specify exactly, you know, the funding that is allocated to us as a council. I think we expressed very strongly here that we would like to see the possibility of an actual animal welfare officer based in our council, and with the service level agreement being 7 years old, I'm thinking it might be worth time if we possibly bring a report back which shows our options and how we could have an animal welfare officer dedicated here out of the £1.25 million from DERA over the 5 councils. So, Chair, very quickly, I'll not keep you long. I'm just open to propose that we bring a report which shows our options on how we can have an animal welfare officer dedicated here in council. Thank you, Chair.
Thanking you, Rachel. Alderman Hussey, Derek.
Chair, not a member of committee, but I completely endorse what Councillor Ferguson has said there. Others will know that I have also queried as to why Derry City and Strabane does not have its own animal welfare service servicing our council area and having to rely on service from basically from Oma. It's not good enough on this particular issue. Thank you, Chair.
Thank you, Derek. I have a number of speakers here, folks. Just let me work my way through them. Sir, Lillian Simoy Bar, please. Lillian.
Thank you, Chair, and for bringing me in. I also would like to welcome the report and commend officers for the good work done. I think the proposal from Councillor Ferguson to explore ways that we can have a local animal welfare officer based in the council area is a very good one. And looking at the report, it's a bit grim. You know, there were 330 animals welfare cases referred to the agencies and 537 enforcement inspection visits here in the city. And we do know that during lockdown, a lot of people in the council area brought pets for company. And many pets owners would look after their pets and they will treat them with love and as members of the family. But we have seen horrific images of abuse and cruelty also. And I am in no doubt that there may have been cases where abuse of animals have gone unreported. So there is an advantage of having a locally based animal welfare officer, not just for reporting animal cruelty, but also supporting first-time pet owners. I do know that in other areas in the UK, animal welfare officers would hold community events to support pet owners and support charities that rescue those abandoned animals to access routine or preventative treatments. So it is worth looking in depth how we can have our own local welfare, animal welfare officer. So I'm really happy to second Councillor Ferguson's proposal. Thanks, Chair.
Thank you, Lillian. Alderman Devaney Morris, I'll come back to you in a wee minute around item 14. I just want to get in terms of item 15 and the proposal from Councillor Ferguson. Rachel, can you write that up? See, it's seconded by Councillor Boyle, Michaela, and most people speaking to it have spoken support of it, but if we could see it in writing, please.
And just to note, Chair, we would support the proposal on item 15 as well.
Okay, Morris, I just want to finish this up before moving to item 14.
Sorry, Chair, just having a quick check. Difficulties. Give me 2 seconds, man. Get in the chat box.
Not on yet, Rachel. It's not there yet, from what I can see, anyway. That's it there now. Rachel, just give a couple of minutes for people to read over it. It's proposed and seconded. And if people are happy enough to go with it, unless they hear anything different. Okay, members. Okay, that's proposed for item 15. Thank you. Alderman Devaney, item 14.
Thank you, Chair, for allowing me in, and I'll be very brief. And look, as I look at the report, for me, it makes sometimes very, very stark reading. When you look at 16 penalty notices for dog stray and 57 for failure to license a dog and 4 for dog fouling. I suppose the first question I would like to ask is, look, how many of them have, how much has been paid in those fines, or many of those fixed penalties have we had the fines recuperated financially? Look, the 16 dogs straying, out of the 57 for failure to license, are we any idea how many of those 57 licensed the dog after the fixed penalty went out? And once again, look, Chair, out of all the initiatives that we have promoted through council, we had mayors, and when Councillor Tierney was mayor, promoted the issue around dog fouling and stuff like that there, and still we have 4 dog fouling penalties issued to me, which is very, very low. And Chair, I'm going to ask for a report to come back once again on the financial implications of how much we have spent since 2015 on promotion of dog fighting and that type of stuff, because when I see the initiatives that we have went through this council, and we're not even getting near the box with 4 dog fighting tickets handed out, so I do believe there's a difficulty there. But thanks, Chair.
Thank you, Morris. Councillor Boyle, Michaela.
Yeah, Chair, thank you. No, I just wanted to put on record my thanks to Seamus and his team for the dog fouling initiatives in terms of signs for business. I contacted him because a number of businesses in Strabane had particular problems with dog fouling outside of their businesses, particularly in the evening times. People out for a leisurely stroll and allowing their dogs to foul. And the initiative was to get some signage for businesses to put into their window. So I just want to congratulate Seamus and thank him very much for that. Thank you.
Thank you. And with regard to Alderman Devaney's paper being brought back.
Yeah, Chair, by all means, we'll bring a report back in terms of fixed penalty income. In relation to dog fouling, I suppose I've repeated this at numerous committee meetings. We have to witness the offence, and it's a large council area. Members be mindful that an initiative was carried out last summer where we had 40 members of staff carrying out patrols on a regular basis, early morning, late evening, and no offences were witnessed. So it is a very difficult issue to deal with, and irrespective of the amount of resource that you put towards this issue, there's no guarantee that there'll be an increase in fixed penalty notices being issued.
Councillor Tierney, Brian.
Chair, thank you. And by no means being an expert in this, but in my view, the only way that we're going to reduce this is by education. You know, you can have all the signs that you want. You can have all the billboards. It's about education and making sure that people are nearly embarrassed and they're allowing their dogs to foul in the street. As Alderman Devaney touched on, and members will know, during my time as mayor, I spent a lot of time in different DEAs across this council area, trying to help promote the offence that it is. But some of the people who were most annoyed about dog fouling are responsible dog owners, because they're almost guilty by association. And I think, you know, they almost feel as if they're getting the blame, whilst they have the bags and they're responsible and all of that. It's those that are not responsible we should be targeting. But I think the only way to do it is around education and making sure that we're doing that. And I think the way to do it is about getting into schools, primary schools in particular, getting into youth clubs, making sure we're putting the message out, and making sure that if a family is out walking the dog, that the child is the one that's saying, here, we need to take a bag, or we can't allow the dog to do that. And the child is almost leading the family, because it's going to take a mind change for many, many people who have dogs and who have grown up perhaps themselves with dogs. So I think, you know, whilst I know the dog wardens do a fantastic job, there's no doubt about that, but I think, you know, and I know Alderman Devaney has asked around the expenditure of the scheme. I think we need to be looking at how we can get in to youth clubs and schools and stuff like that. And we need to ask ourselves the question, is the money that we're spending on a public advertisement better used in trying to facilitate the dog wardens or the staff that were employed last summer going into schools and trying to address it that way? Because, you know, and I think we all have learned this throughout the last couple of weeks. A billboard is a billboard, but it very soon fades into the background. And whilst, you know, and when you look, I suppose this is a side point, but when you look at the cost of some of them billboards for 2 weeks or for 4 weeks, could that money be better? I'm not saying it can, but could that money be better spent in targeting and directly talking to young people and making them aware of the dangers and the implications, rather than a big public advert to show that we're doing a big public advert and not really getting to the crux of the problem? And I think that's a conversation that we need to be having in terms of the best use of money around this advertisement, around this campaign. Thank you.
Thanking you, Brian. So we okay, folks, in terms of a paper coming back looking at the different aspects to this? Is that okay, Sean? Okay, members, thanking you regard item 14. I don't see anybody else in terms of matters open for information. And if there isn't, I'm going to ask for a proposal to get into confidential, please.
So proposed, Chair, or seconded.
Okay, proposed by Councillor Tierney, Brian, seconded by Alderman Devaney. Morris, thanking you.